So good evening everyone. Hopefully I'm audible. So hopefully the audio and visual is clear. Good evening everyone. Great. So now, Bache, today we'll be talking about ENT, and in ENT we'll be talking about the high yield topics from the first part of ENT, and that is larynx. Okay, so in the subsequent videos we'll be talking about each and every part of ENT, like larynx, pharynx. Then I'll be talking about the nose and the paranasal sinuses, and ultimately we'll talk about the ear. And in each of these parts, beta, we'll be talking about the high yield topics from these particular aspects or from these particular parts. Okay. So the other topics which you feel would be missing or something would be covered in other parts. Like for example, if I talk about cancer larynx, beta, I'll be covering cancer larynx in the cancers that I'll cover with surgery parts as well. Okay? So don't worry about that. So hopefully these are going to help you. Again, most important thing, those who are reading from their notes, beta, the primary source for your revision should be your notes itself. These are for your better understanding. These videos will be helping you to understand which topics are actually more important, कहाँ पे concepts clear करने की ज़्यादा ज़रूरत है, right? So ये वाले जो sessions होंगे, these will be to understand each and every topic much better in an easier way. And definitely अगर कोई दिक्कत होगी, you can reach out to me at any of my handles for any kind of doubts, बेटा. ठीक है? चलो. So now let's talk about ENT, beta. So in ENT we are talking about larynx. Basically ये समझ लो ENT में 3 parts होता है, that is ear, nose and the throat, beta. In throat usually ये जो गला होता है, in throat definitely we are having 2 kinds of cylinders. Yes, 2 तरीके के cylinder होता है. One cylinder is anterior बच्चे, which is a shorter one, and the second cylinder is posterior beta, which is a longer one. So the anterior shorter cylinder जो मैं बोल रहा हूँ, जो गले में होता है, that is what is known as the larynx, and the posterior longer cylinder that we have beta, that posterior longer cylinder in the throat is what is called as the pharynx. ठीक है? तो आगे वाला छोटा cylinder larynx, पीछे वाला बड़ा cylinder is known as pharynx. Now this anterior shorter cylinder which is there, that is your larynx beta. ये larynx का extension या level पूछे जाता है. This has been asked in your examination earlier. So please remember, if they ask you ये जो larynx होता है ये किस level पे located होता है. So we know बेटा neck के level पे we are going to have the cervical vertebra itself. So at which cervical vertebra this larynx is going to be present. So please remember, it extends from the 3rd cervical vertebra, that is C3, to the 6th cervical vertebra, that is C6 बच्चे. ठीक है? It extends from the 3rd cervical vertebra till the 6th cervical vertebra. If I talk about that posterior cylinder known as the pharynx बच्चे, that posterior cylinder of pharynx जो होता है, that is longer, I told you, right? It starts from the skull base itself. It starts from the skull base and it ends with the larynx at the level of the C6. So pharynx is longer, therefore it starts from the skull base and it ends with the pharynx at the level of the C6. ठीक है? Now larynx की अगर पूछे extension, so you know the laryngeal extension is from C3 to C6. First important point. Second point beta, this larynx which is a cylinder, it is made up of what structures? So ये जो larynx होता है ये 2 चीजों से बना हुआ होता है. It is made up of 2 things बच्चे. One is definitely the outer framework या जो बाहरी structure होता है बेटा. तो structure किससे बनता है? The basic framework or the structure of the larynx is made up of cartilages. Right? So it is made up of one cartilages से उसका structure बनेगा, and second thing will be the muscles beta. So one thing definitely which is going to make up the larynx is the cartilages, and second thing will be the muscles. So cartilages and muscles are the 2 components or 2 parts of the larynx. If I talk about the cartilages, basically कितने cartilages होते हैं which are going to make up the larynx? How many cartilages make up the larynx beta? So please remember, अगर मैं types की बात करूँ, if I talk about the types, then there are total 6 cartilages which will make up the larynx. Okay, so please remember कितने cartilages make up the larynx? There are total 6 cartilages which are going to make up the larynx. These 6 cartilages are divided into 2 types. ये 6 cartilages जो होते हैं, they are actually divided into 2 groups. Like out of them, some are going to be unpaired cartilages. Unpaired का मतलब क्या? Single, अकेला, right? So definitely some of them are going to be unpaired cartilages beta, and some of them are going to be paired cartilages. Okay, some of them are going to be paired cartilages. Paired मतलब जोड़ी जोड़ी में, right? Important is if I talk about how many out of these 6 will be unpaired cartilages. इन 6 में से कितने unpaired होते हैं बेटा? So please remember 3 of them will be unpaired cartilages, right? 3 of them are going to be unpaired cartilages, whereas the rest 3 are going to be paired cartilages. Rest 3 will be paired cartilages. So total type of cartilages अगर larynx के पूछे तो answer has to be 6 बेटा, but total number of cartilages पूछे. So tell me the total number of cartilages, anybody? So the total number of cartilages if they ask you beta, it has to be 9. How 9? Obviously 3 unpaired cartilages and 3 paired है, तो 3 2s are 6 हो जाएगा. So total number of cartilages will be 9, but total types of cartilages will be 6. No issues with this, anybody? Now if I talk about the, तुम्हें लगेगा कि इस basic anatomy पे कौन सवाल पूछेगा? Please remember beta, there has been a previous year question recently in June 2021 on the laryngeal cartilages. And what was the question? All of the following are paired laryngeal cartilages except. So they were asking about the unpaired cartilage. ठीक है, तो इसके लिए देख रहे थे. So we know that out of the total 6 cartilages, 3 of them are unpaired, and 3 unpaired में से याद रखना. The first one is the largest laryngeal cartilage called as the thyroid cartilage. First is the largest laryngeal cartilage known as the thyroid cartilage. Okay, and this forms the outer framework of the larynx. Second definitely is a ring-like cartilage, which again forms the outer framework of the larynx, and this ring-like cartilage beta is known as the cricoid. ठीक है? Whereas third cartilage which is there, this does not form the outer framework of larynx. ये बाहरी structure नहीं बनाता larynx का, but this cartilage is present inside the larynx. ये larynx के अंदर present होता है बेटा. And that third unpaired cartilage is a leaf-like cartilage. Okay, it is known as epiglottis. तो ये epiglottis क्या करता है बेटा? It is a leaf-like cartilage and it actually controls the opening or closing of the larynx. Okay, ये जब cartilage है, definitely it can control the opening or the closing of the larynx. तो ये दरवाजे की तरह, door की तरह काम करता है, याद रखना. Please remember that. Okay, so there are 3 unpaired cartilages: thyroid, cricoid, and epiglottis. Whereas the 3 paired cartilages, let's write them down. The 3 paired cartilages beta. First pair of cartilage is known as the arytenoids or the arytenoid cartilages. ये जो arytenoids होते हैं, they are actually form the posterior 1/3 of the vocal cord. So we know that larynx जो होता है उसको sound box भी बोला जाता है. क्यों sound box बोला जाता है? Because it is able to produce voice or sound beta. And why it is able to produce sound? Because inside the larynx we have 2 vocal cords. When these vocal cords will vibrate beta, जब ये vocal cords vibrate होंगे, so definitely these vibrations will produce a sound which can be converted into speech with the help of your pharynx and the oral cavity further. Got it? So definitely इसलिए larynx को sound box भी बोला जाता है because it can produce sound with the help of these vocal cords. तुम बोलोगे so vocal cords तो membrane से बने होते हैं. Please remember बच्चे that anterior 2/3 of the vocal cord is membranous. वो जो membrane से बना होगा, ठीक है? For example अगर मैं बात करूँ, ये larynx है तुम्हारा, तो उसमें जो anterior 1/3 है vocal, anterior 2/3 है vocal cord का, that is definitely made up of a membrane. But जो posterior 1/3 होता है, the posterior 1/3 is made up of these cartilages. Can you see these triangular or pyramidal cartilages? So the posterior 1/3 is made up of these pyramidal or triangular cartilages, और इन्हीं pyramidal या triangular cartilages को बोला जाता है arytenoids. These ones are known as arytenoids beta. Got it? So please remember the first pair of cartilages is nothing else but arytenoid cartilages. Okay, second ones, they are sitting on top of the arytenoid. अब ये बाकी के जो 2 होते हैं pairs, these are sitting on top of the arytenoids बेटा, उसके सर पे बैठे होते हैं. So the first one is called as corniculate cartilage. Now why this is called as corniculate, you'll understand. Cornu in Latin means horn beta. Okay, seeing. ठीक है? So definitely the corniculate cartilages are sitting on top of the arytenoid and they look like horns of arytenoid. कैसा लग रहा है? ऐसा लग रहा है ना कि हॉर्न है या कॉर्न है arytenoids के. So therefore they are called as corniculate, horn like cartilages. And उसी के बगल में बेटा, उसी के बगल में छोटे छोटे, एकदम छोटे छोटे राइस ग्रेन जैसे cartilages होंगे, and these will be called as cuneiform cartilages. ठीक है? These will be known as cuneiform cartilages. So can you see definitely there are 3 unpaired and 3 paired cartilages. The 3 unpaired I'm repeating is thyroid, cricoid and epiglottis. The 3 pairs are known as arytenoids, corniculate and cuneiform cartilages. याद रखना All other cartilages are present inside the larynx except two. And which are those two which can be present outside the larynx or which can form the external framework or structure of the larynx? Pehla, it was the thyroid cartilage, and second was the cricoid cartilage. यहाँ पे देख सकते हो बेटा. Can you see this is the hyoid bone? इसको छोड़ो. So the first one that you can see on the top, beta, it is not a cartilage, it is a bone, and that is a hyoid bone. I hope you are aware of the question from hyoid bone. The only bone in the body which has no bony attachment. वो किसी और bone के साथ attached नहीं होता. So how is it present inside the neck? It is actually hanging inside the neck, beta. It is hanging inside the neck, or it is suspended in the neck with the help of the muscles. Muscles की मदद से वो लटक रहा होता है neck में, ठीक है? So that is your hyoid bone. Just below the hyoid bone, beta, you are able to see this largest cartilage, and this largest cartilage of the larynx, okay, is what is called as your thyroid cartilage, right? This largest cartilage of the larynx is known as your thyroid cartilage. Can you see? The thyroid cartilage is an open book like cartilage. ऐसा लग रहा है ना कि किसी ने किताब खोल दी है. Somebody has opened a book. Okay, that means definitely this thyroid cartilage is an open book like cartilage. It has two laminae or it has two wings to it. Right? दो wings की तरह दिख रहा है ना. So thyroid cartilage is an open book like cartilage which is made up of two wings. And both these wings are attached at an angle, beta. Can you see? The thyroid cartilage is not flat. Thyroid cartilage ऐसा flat नहीं है. It is attached at an angle. Okay, both the wings of the thyroid cartilage are attached at an angle, and इसी angle को बोला जाता है thyroid angle. Got it? So these two thyroid wings, thyroid cartilage के wings are attached at an angle called as thyroid angle. Please tell me that this angle which is there, beta, this angle which is there, it is more prominent in males or females? Please tell me. This angle is more prominent in males or females, beta? This thyroid angle which is there, okay, it is more prominent in males or females? So this thyroid angle is going to be 90 degree right angle in males, beta, and 120 degree in females. Got it? It is 90 degree in males and it is 120 degree in females. So can we say that definitely in males? Can you see? So definitely it is 90 degree in males and 120 degree in females. Females में ऐसा लग रहा है थोड़ा सा flat है, right? It is looking like it is more flatter in females, but it is more prominent in males, beta. It is more prominent in males definitely, and this prominent thyroid angle in males, okay, is what is called as, beta, Adam's apple. This prominent thyroid angle in males is what is known as the Adam's apple. Just below the thyroid cartilage, are you able to see this another ring-like cartilage? Just below the thyroid, you are able to see this ring-like cartilage. This ring-like, तुम्हें इस तरफ से एक ही part दिख रहा है लिंक का बेटा, but totally completely it is like this. For example, if I talk about the cricoid, it is something like this cartilage, beta, just like a ring. एक हिस्सा broad होता है, दूसरा हिस्सा narrow होता है. You can see a ring ना, one part of it is broad, the other part it is narrow, just like that. It is a ring-like cartilage. Okay, it is ring-like because there is empty space in between the cartilage, beta. There is empty space inside this cartilage. This is called as your cricoid cartilage. So the two cartilages which are present on the external surface of the larynx, or I can say which forms the external structure of the larynx. एक हो गया तुम्हारा thyroid cartilage, second is your cricoid cartilage. If I talk about the inner part of the larynx, beta, can you see this big? ये हम larynx के अंदर जा चुके हैं बेटा. We are inside the larynx now. So you are able to see this leaf-like cartilage or this leaf-shaped cartilage, a large leaf-like cartilage which is present inside the larynx, right? So this large leaf-like cartilage which is present inside the larynx, and as I told you, it can control the opening or closing of the larynx. This is what is known as your epiglottis. This cartilage is what is called as your epiglottis, beta. ठीक है? Glottis क्या होता है? Glottis is actually another name for your vocal cords. Vocal cords, the true vocal cords in Latin are also known as glottis. Therefore, the cartilage which is present above the glottis will be called as epiglottis. So here you can see the vocal cords will be attached over here, beta. तो याद रखना, as epiglottis is a cartilage which is above the true vocal cords or above the glottis, it is also known as epiglottis. ठीक है? Now we know that the posterior 1/3 of the vocal cord is formed by these two pyramidal or these two triangular cartilages. These two pyramidal or triangular cartilages, बच्चे, is nothing else but your arytenoid cartilages. These are nothing else but your arytenoid cartilages. And just above these triangular arytenoid cartilages, we have two horn-like cartilages. मैंने बोला था ना, arytenoid के सींग हो, arytenoid के horn हो, ऐसा लग रहा है. So these two horn-like cartilages above the arytenoids are called as corniculate cartilages. They look like cornu of the arytenoids. These are corniculate cartilages. And just beside these corniculate cartilages, these two small rice grain like cartilages will be called as your cuneiform cartilages beta. ये जो red वाले निकाले, these are nothing else but your cuneiform cartilages. Okay, so please remember that these are all the cartilages of the larynx, and this is the structure of larynx. Previous year question was, all of the following are paired cartilages of larynx except, and the options were arytenoids, corniculate, cuneiform, and epiglottis. And obviously the answer is very clear. It is epiglottis beta, which is an unpaired cartilage of the larynx. Okay. Now if I talk about embryology, so please remember embryology, that means from where is the larynx or its parts derived from. So I hope all of you are quite aware beta that all the structures in the neck region or in the head region, they are derived from the pharyngeal cleft, pharyngeal arc or the pharyngeal pouch. Okay, क्या होता है? Your mesoderm, your endoderm and your ectoderm beta at the level of the neck during organogenesis, ये क्या बनाते हैं? For example, your mesoderms come together, your mesoderm come together beta, and it forms the pharyngeal arcs, या इसको तुम brachial arcs भी बोल सकते हो. How many pharyngeal or brachial arcs we have beta? There are total 6 pharyngeal arcs, but the 5th pharyngeal arc which is there, definitely it obliterates, वो गायब हो जाती है, it disappears, right? So totally there are total 6 pharyngeal arcs, but the 5th one disappears. This is formed by the mesoderm. Okay, the arcs are usually formed by the mesoderm. Then on the outside beta, there will be formation of clefts. ये जो green वाले निकाल रहा हूँ, these are nothing else but your ectodermal clefts or the pharyngeal clefts. And from inside beta, definitely there will be formation of pouch. Pouch कहाँ रखते हो? अंदर. So as such, you can remember these blue ones which are there beta, they are formed by the endoderm, and these are nothing else but your pouches. So these are your endodermal pouches. So mesoderm forms the arcs. Okay, ectoderm forms the clefts, and endoderm forms the pouches, and all these structures together will give rise to all the structures present in the head and neck region. जब हम ear की बात करेंगे बेटा, then we will be talking about the first and the second arc, because the structures of the ear are derived from the first and second arc. But if I talk about the throat beta, mainly the larynx and the pharynx, then you are concerned mainly with the 4th and the 6th arc. Yes, larynx and pharynx की अगर बात करें तो larynx and pharynx are usually derived from these 4th and the 6th arc beta. Okay, so let's talk about that now. First, if I talk about the 4th pharyngeal arc, so what are the structures which are derived from 4th pharyngeal arc? We know there are total 6 types of laryngeal cartilages. Out of them, 3 are derived from the 4th arc, and 3 of them will be derived from the 6th arc beta. Okay? So what are the 3 cartilages which are derived from the 4th pharyngeal arc? ठीक है, याद रखना, इसको याद रखने का mnemonic, it is nothing else but cute बच्चे. So the cute cartilages are derived from the 4th pharyngeal arc. What are these cute? CU beta usually stands from the cuneiform cartilages. CU stands for the cuneiform cartilages. T usually stands for the thyroid cartilage. T usually stands for the thyroid cartilage, and E usually stands for the epiglottis. E usually stands for the epiglottis. So definitely beta, cuneiform, thyroid and epiglottis are the 3 cartilages which are derived from the 4th pharyngeal arc. No issues till anybody? That is all about your cartilages. Obviously, if these 3 are derived from 4th arc, the rest 3 will be derived from the 6th arc, right? Next important beta, let's talk about the muscles. I told you one part of the larynx is made up of the cartilage, second part is made up of the muscles. Now there are 2 types of muscles inside the larynx. समझ लो. There are some group of muscles which are responsible for the external movement of larynx beta. Okay, some group of muscles responsible for external movement of larynx. एक तो larynx को उठाना या गिराना, that is elevation or depression of larynx. So the muscles which are responsible for external movement of larynx are called as extrinsic muscles, right? उनको क्या बोलोगे? Extrinsic muscles. And the muscles which are responsible for internal movement of larynx are called as intrinsic muscles. What do I mean by intrinsic movement? What is present inside the vocal, inside the larynx which moves beta? The vocal cords. Okay, so can I say the muscles which are responsible for the movement of the vocal cord, जो muscles vocal cord के movement के लिए जिम्मेदार होती है, those are actually called as the intrinsic muscles of the larynx. Got it? Those are known as intrinsic muscles. समझ गए? 2 group of muscles in larynx, extrinsic group and the intrinsic group of muscle. So if I talk about the muscles which are present, which are responsible for the external movement, the extrinsic group of muscles, all these extrinsic group of muscles are derived from the 4th pharyngeal arc. Okay? So please remember, all the extrinsic laryngeal muscles, all these extrinsic laryngeal muscles are derived from the 4th pharyngeal arc. बेटा याद रखना एक बार. All these extrinsic laryngeal muscles are derived from the 4th pharyngeal arc. Next important, if I talk about, is the intrinsic laryngeal muscles. So please remember, all the intrinsic laryngeal muscles are usually derived from the sixth arc, but there's an exception to it. We'll talk about that exception in a while. Okay? All extrinsic muscles from fourth arc, all intrinsic muscles from sixth arc with an exception. Okay? ये तो हो गया larynx के बारे में. What about the pharynx? Pharynx, beta, as larynx I told you is made up of two things, cartilage and muscles. Pharynx on the other hand is only and only made up of muscle. Pharynx ऐसा cylinder होता है which is only made up of muscles. And all these pharyngeal muscles which are there, beta, all the pharyngeal muscles are derived from the fourth pharyngeal arc. All pharyngeal muscles are derived from the fourth pharyngeal arc. ठीक है, except one muscle, beta. And this was a previous year question. Anatomy से मान लो, ENT से मान लो. Okay, all pharyngeal muscles are derived from the fourth pharyngeal arc, except which pharyngeal muscle is not derived from the fourth pharyngeal arc? Anybody? This has been a question previous year. Which pharyngeal muscle is not derived from the fourth pharyngeal arc? Anybody? So please remember that muscle is known as stylopharyngeus. That muscle is known as stylopharyngeus. So all pharyngeal muscles are derived from the fourth pharyngeal arc except the stylopharyngeus muscle, and the stylopharyngeus muscle is a derivative of. The stylopharyngeus muscle is a derivative of third arc or the third pharyngeal arc. Okay? Previous year question, please remember this अच्छे से. Okay? So all the pharyngeal muscles are derived from the fourth arc except the stylopharyngeus muscle, which is a derivative of the third arc. Okay? Now lastly, about the nerve supply. We know, beta, there are two types of nerves which are going to supply the larynx. Okay, and these two nerves are, one is called as the SLN. What is meant by SLN? Superior laryngeal nerve. Second is called as the RLN, that is recurrent laryngeal nerve. तो एक तो हो गई superior laryngeal nerve, दूसरी होगी recurrent laryngeal nerve. And both of these nerves are branches of your 10th cranial nerve. 10th cranial nerve कौन सी होती है बेटा? The vagus nerve, right? So the nerve supply to the larynx, in short I can say, comes from the vagus nerve. Vagus nerve की दो branches से आता है. One called as the SLN, that is your superior laryngeal nerve. Second called as the RLN, called as the recurrent laryngeal nerve. Now out of them, beta, obviously the superior laryngeal nerve will be derived from the upper wala arc, that is the fourth arc. So please remember, if I talk about the nerve supply, the SLN, that is your superior laryngeal nerve, is a derivative of the fourth pharyngeal arc. Done with this? So these are all the derivatives of the fourth arc, beta. Embryology से इतना याद रखना है. Acute cartilages, all extrinsic laryngeal muscles, all pharyngeal muscles except stylopharyngeus, which is the derivative of third arc, and lastly the superior laryngeal nerve or the SLN. Now if I talk about the derivatives of the sixth pharyngeal arc, beta, sixth pharyngeal arc से बचे कुछ तीन cartilages are derived from. What are these three cartilages? CAC cartilages. Okay. What are these CAC cartilages? Usually first, C stands for the ring-like cartilage known as cricoid cartilage. A stands for the cartilage which makes up the vocal cords, that is arytenoid cartilages. And last, C stands for the corniculate cartilage. So cricoid cartilage, arytenoids and corniculate cartilages, these are the three cartilages which are derived from the sixth pharyngeal arc. Next important, we have discussed that there are two groups of muscles in the larynx, extrinsic and intrinsic. All the extrinsic muscles were derived from the fourth arc and all the intrinsic muscles will be derived from the sixth arc. So please remember, all the intrinsic laryngeal muscles, beta, all the intrinsic laryngeal muscles, okay, all the intrinsic laryngeal muscles are derived from the sixth arc except one exception to be remembered. And what is that exception? And please remember, this muscle is always going to be an exception. What do I mean by this? Yeah, three important points. One, all the intrinsic laryngeal muscles are present inside the larynx except one, that is cricothyroid muscle. Even though it is an intrinsic muscle, it is present outside the larynx. Okay? Yaad rakhna important. All intrinsic laryngeal muscles are present inside the larynx except one, that is cricothyroid, which is present outside the larynx. First point. Second point, all intrinsic laryngeal muscles are derivatives or are derived from the sixth pharyngeal arc except cricothyroid. And this cricothyroid, though it is an intrinsic laryngeal muscle, it is still derived from, okay, it is still derived from, beta, the fourth arc. Okay, yaad rakhna. So all intrinsic laryngeal muscles are derivatives of the sixth pharyngeal arc except cricothyroid, which is a derivative of the fourth pharyngeal arc. And last point, all the intrinsic laryngeal muscles are supplied by or are innervated by ठीक है, तो all intrinsic laryngeal muscles are supplied by or they are innervated by the fourth pharyngeal arc beta, except cricothyroid. Okay, sorry, all intrinsic laryngeal muscles are supplied by the RLN, that is your recurrent laryngeal nerve, except the cricothyroid beta, which is supplied by the external branch of superior laryngeal nerve. याद रखना, last point, all intrinsic laryngeal muscles are supplied by RLN, that is recurrent laryngeal nerve, except cricothyroid, which is supplied by the external branch of SLN, that is superior laryngeal nerve. No issues till here. 3 points about cricothyroid you have to remember. It is always an exception. Next, if I talk about the nerve now, last one. So we know that if the SLN, superior laryngeal nerve, is derived from the fourth arc, obviously the RLN, that is your recurrent laryngeal nerve, will be a derivative of the sixth pharyngeal arc. Okay? So now just revising all the derivatives of the sixth arc beta: CAC cartilages, that is cricoid, arytenoid and corniculate. All the intrinsic laryngeal muscles except the cricothyroid, which is derived from fourth arc, and lastly the RLN, that is your recurrent laryngeal nerve. These are the derivatives of the sixth arc. Now let us talk about the next question, which has been asked in the previous year exams also. What is that question, beta? It states a patient while having meal suddenly started having choking sensation with aphonia. What is aphonia? Loss of voice. Patient is not able to speak. Okay, that is called as aphonia, beta. Along with respiratory distress. So sudden choking sensation, aphonia, that is loss of voice, and respiratory distress. What is the likely cause of it? Obviously he was having a meal, beta. Okay, it commonly happens with alcoholic patients. Okay, when the cough reflex or the gag reflex is suppressed, usually तब होता है ये ज़्यादातर. और क्या होगा? When the patient was having the meal, by mistake, meal कहाँ जाना चाहिए बेटा? खाना कहाँ जाना चाहिए? Obviously it should go into the pharynx, and from there it should go into the esophagus and the GIT. But यहाँ गलती से क्या हो जाता है? Definitely the larynx was not able to close properly, and therefore the food went inside the larynx, beta. And from the larynx it will go inside the airway. And जब खाना larynx में चला जाता है, that is what is known as aspiration, right? That is risky. And if there is food inside the larynx, beta, obviously the patient will feel there is some blockage inside the larynx. Patient will not be able to breathe because larynx is continuous with the trachea or your windpipe. It is a part of the airway itself. So अगर airway block हो जाता है, your patient will not be able to breathe, right? So whenever the food goes inside the larynx, patient might have respiratory distress. Patient will not be able to produce voice, and the patient will have a choking sensation. This is a very classical sign of choking, beta. This is how a patient presents to you with choking. ठीक है? तो यहाँ पे क्या हो गया? गलती से खाना larynx में चला गया. So can I say the cause in this condition is nothing else but a impacted food material? Okay, there is some impacted food material in the larynx. What is the treatment if there is impacted food material in the larynx and patient presents to us in the emergency? You have to perform a manure, beta. To make manure perform करना है on this patient so that the food material which is present inside the larynx, it is thrown out. ठीक है? वो कैसे होगा? With this manure. This has been asked as an image based question in your examination also. ये कौन सा manure perform किया जा रहा है? Okay? So can you see? You have to stand behind the patient. You have to hold the patient, beta, over his epigastrium. ये जो हिस्सा होता है छाती के जस्ट नीचे, you have to hold the patient on the epigastrium, and now you have to give upward and backward pressure, beta. Upward and backward pressure you have to give. Why? Because when you give upward and backward pressure, the pressure inside the airway increases, and due to that pressure, beta, whatever food material was present inside the larynx, due to that pressure coming from down, this food material will be thrown out. Got it? So due to that pressure coming from the chest, beta, this food material is thrown out. Got it? So this is what is called as your Heimlich's manure. So if they ask you what is done for treatment if a patient comes to you with impacted food material in the airway with signs which are given over here like choking sensation, the answer has to be Heimlich's manure. ठीक है? और Heimlich's manure में क्या किया हमने? You have to apply pressure or you have to give thrust over the epigastrium. In which direction? In upward and backward direction, beta. ठीक है? So this has been a very common question of your examination. Don't make a mistake if this is repeated. ठीक है? Next important, if I talk about the three divisions of your larynx. What are the three divisions of your larynx, beta? So please remember, the larynx is divided into three parts. First, the reference point should be, beta, yaad rakhna, the true vocal cord. Okay? So for example, if I talk about this is your larynx, which is a cylinder, and ये तुम्हारे vocal cords यहाँ पे. So these vocal cords which are there, beta, these are known as the glottis. ये जो true vocal cords है, they are called as the glottis. All the area above the glottis, okay, all the area above the glottis will be called as supraglottis. बराबर? All the area above the true vocal cords will be called as supraglottis, and all the area below the true vocal cords, all the area below the true vocal cords or below the glottis will be called as subglottis. Got it? So larynx is divided into three parts or three divisions. One part which is above the true vocal cords called as supraglottis, one part which is below the true vocal cords called as subglottis, and the third one, the true vocal cords themselves, that is nothing else but the glottis. So the three divisions, the first one being supraglottis, right? The second one, the first one being supraglottis, the second one being glottis, that is your true vocal cords, and the third one being beta subglottis. Okay? These are the three parts or the three divisions of your larynx. Okay? याद रखने के बाद. Important is to understand the supraglottis better, beta. याद रखना, this supraglottis, it actually has 5 parts in it. The supraglottis division which is there, it actually is made up of 5 parts, because then you will be able to understand the diseases that we'll discuss. Okay? And what are these 5 parts of your supraglottis? First, obviously, the leaf-like cartilage which controls the opening or closing of the larynx. Okay? And that leaf-like cartilage is known as the epiglottis. Okay? Second important beta, please remember, we know that epiglottis is anteriorly inside the larynx. Okay. Epiglottis is anteriorly inside the larynx, and arytenoids are posterior in the larynx. So there are mucosal folds which are going to connect the arytenoids and the epiglottis. There are mucosal folds which are going to connect the arytenoids and the epiglottis beta. These mucosal folds are called as epiglottic folds, क्योंकि वो arytenoids और epiglottis के बीच में है. Therefore these folds will be called as the epiglottic folds. So the second part will be the AE folds or the epiglottic folds. The third part beta, please remember, for example, this is how the supraglottis will look like. Okay? Now what is this? These are your true vocal cords or your glottis. Okay, these are your true vocal cords or your glottis. But above the true vocal cords, above and lateral to the true vocal cords, can you see there are another folds also? Above and lateral to the true vocal cords, there are also another folds, and these folds are called as the false vocal cords beta. Got it? So these folds, mucosa ke folds which are present above and lateral to the true vocal cords are known as your false vocal cord. Okay? Can you see there is some space between the true vocal cords and the false vocal cord? This space between true and false vocal cord bache is what is called as the ventricle. This space between the true and the false vocal cord is known as the ventricle. Okay? And from the ventricle, can you see there is outpouching? जो ventricle है वहां से एक outpouching निकल रही है. See, on both the sides there are true vocal cords, on both the sides there are false vocal cords, on both the sides there is space that is called as ventricle, and on both the sides there will be outpouching beta, and this outpouching from the ventricle is known as the saccule. This outpouching from the ventricle is what is called as the saccule. No issues till here? So that is important to be remembered. So the other parts now we have discussed already. So the first part that you have to remember is the false vocal cords. And please remember, false vocal cords are also known as ventricular bands. These false vocal cords which are there beta, they are also referred to as the ventricular bands. Please tell me, जो voice production होता है, जो sound production होता है, is it done by the true vocal cords or the false vocal cord? Obviously it will be done by the true vocal cord, इसीलिए उनको true कहा जा रहा है. Right? Whereas false vocal cord जो होते हैं बेटा, they are rudimentary. What do I mean by rudimentary? Which has no functional value, जिसका कोई काम नहीं है, ये किसी काम के नहीं होते. Right? So false vocal cords or your ventricular bands beta, they are rudimentary in nature. That means they do not have any kind of functional value. ठीक है? Next part, the fourth part which was there beta, it was the space between the true and the false vocal cord called as the ventricle. And the fifth and the last part beta is the outpouching from the ventricle beta, and that outpouching from the ventricle is known as the saccule. That outpouching from the ventricle is known as the saccule. These are the 5 parts of the supraglottis. No issues till here anybody? So that has to be remembered. Okay? So this is important for your basic understanding to know कि क्या दिक्कत हो रही है. Right? No issues till here? Hopefully that was very clear to all of you. Please remember that. Now let us discuss about this question, and then we'll be talking about the nerve supply of the larynx beta. So Over here the question says, this was a recent FMGE exam question, beta, it is a recall. A patient underwent surgery for the removal of cystic mass. He underwent a surgery for removal of some cystic mass inside the neck, beta. Okay. Cyst क्या होता है? Cyst is nothing else but a sac which contains fluid, is called as cyst. Okay. So there was some kind of a cystic mass in the neck for which he underwent a surgery. Post-operatively, after the surgery, beta, patient had aspiration. What is aspiration? I told you, foreign particles entering inside the airway. Can food particle go in the airway? No. So if food particles are going in the airway, that is called as aspiration. Okay? So the patient was having aspirations, but there was no change in voice, without any change in voice. So voice was absolutely normal, beta. Okay? So the voice of this patient was absolutely normal. The only problem of the patient he was suffering from was aspirations. Which is the likely nerve injured in the surgery? So what was the likely nerve injured due to which he was suffering from all these problems? Let's talk about that. So for that understanding, you need to know the innervation of the larynx, or we can call it as the nerve supply of the larynx. Yes, innervation का मतलब ही nerve supply होता है बेटा. Please remember that. So innervation या nerve supply की अगर मैं बात करूँ, if I talk about the innervation or the nerve supply of the larynx, बेटा, please remember there are two types of nerve supply in any organ for that matter. एक होता है the nerve supply to the muscles, beta, and that is called as the motor nerve supply. Why? Because muscles are responsible for the movement, right? So muscles are responsible for movement, therefore the nerve supply or the innervation to the muscle is called as motor nerve supply. Okay? Whereas the nerve supply to the mucosa, the nerve supply to the mucosa is what is called as the sensory nerve supply. Why? Because जो भी sensations तुम्हें feel होते हैं, whatever sensations you will feel in the larynx, it is because of the mucosa. Right? So therefore, the nerve supply to the mucosa will be called a sensory nerve supply. First of all, let's talk about the motor nerve supply, beta. If I talk about the motor nerve supply, basically for us over here, important is to know about the intrinsic laryngeal muscles. I told you there are two groups of laryngeal muscle. One which was responsible for the external movement of larynx, called as your extrinsic muscles, and second responsible for the internal movement of larynx, that is movement of the vocal cords, known as the intrinsic muscle. For you to remember is the intrinsic laryngeal muscles, beta. One statement I have done already, and what was that? All intrinsic laryngeal muscles, okay, all intrinsic laryngeal muscles lie inside the larynx or outside the larynx. So all intrinsic laryngeal muscles, beta, lie inside the larynx, except all intrinsic laryngeal muscles lie inside the larynx. We know the exception. What was that exception always? The cricothyroid. Right? Except the cricothyroid, though it is a intrinsic laryngeal muscle, bache, but where does it lie? It lies outside the larynx. Right? So please remember, all intrinsic laryngeal muscles, okay, yes, no worries about that, sure. So all intrinsic laryngeal muscles, beta, lie inside the larynx except cricothyroid muscle, which lies outside the larynx. Okay, which lies outside the larynx, beta. ठीक है, so याद रखना, all intrinsic laryngeal muscles lie inside the larynx except cricothyroid, which lies outside the larynx. First statement. Therefore, it will be easier for you to remember now that all the intrinsic laryngeal muscles, therefore all the intrinsic laryngeal muscles, beta, are supplied by or are innervated by whatever you feel. You can remember, you can call it supplied or innervated. Okay, so all of these intrinsic laryngeal muscles are supplied by or they are innervated by which nerve? The RLN, which is, okay, the RLN. What is RLN? The recurrent laryngeal nerve. And as always we know there would be some exception, and that exception in the larynx is which muscle? Always the cricothyroid, right? So please remember, all intrinsic laryngeal muscles are supplied by the RLN, that is your recurrent laryngeal nerve, except the cricothyroid muscle, beta, except the cricothyroid muscle, which is supplied by, okay, except the cricothyroid muscle, which is supplied by or which is innervated by. What was the other nerve supplying the larynx, beta? The SLN, the superior laryngeal nerve. So this cricothyroid muscle is supplied by the superior laryngeal nerve, but by actually a branch of the superior laryngeal nerve. Superior laryngeal nerve has two branches, bache. One is the internal branch and second is the external branch. Okay? So cricothyroid muscle is supplied by the external branch. Why external branch? Because it lies outside the larynx, right? So it is supplied by the external branch of superior laryngeal nerve or the SLN. Okay? And this external branch of superior laryngeal nerve is also called as ELN, that is external laryngeal nerve. So don't get confused. Instead of external branch of SLN, if they write ELN, it's one and the same thing, beta. It is one and the same thing. Okay? So all intrinsic laryngeal muscle lie inside the larynx except cricothyroid muscle, which lies outside the larynx. First point. Second point to be remembered, all intrinsic laryngeal muscles are supplied by the recurrent laryngeal nerve except cricothyroid muscle, which is supplied by the external branch of superior laryngeal nerve, which can also be called as the external laryngeal nerve. Okay? याद रखना है बात. So please remember that was about the motor nerve supply. If I talk about the sensory nerve supply, now sensory nerve supply means nerve supply to the mucosa, right? And there are three parts or three divisions of the larynx. हर एक का mucosa अलग nerve से supply होता है बेटा. So first part was what? First part was nothing else but the supraglottis. And please remember, the supraglottis is very rich in nerve supply. Why it has to be rich in nerve supply? Beta, for example, if some food particle tries to enter inside your larynx, immediately you get some irritation in the throat and immediately you have a cough reflex, right? So because of that, definitely any foreign substance is not allowed inside the larynx because it will be immediately thrown out with the help of that cough reflex. And why do we get the cough reflex? Because our supraglottis immediately senses that abnormal thing, right? And कैसे sense कर पाएगा? When there is a rich nerve supply, right? तो याद रखना, supraglottis में rich nerve supply होता है because to prevent any kind of aspirations. Got it? Supraglottis has a rich nerve supply and is supplied by which nerve? So I told you that basically the nerve supply to the larynx and pharynx is by the 10th cranial nerve, that is your vagus nerve. Okay, so 10th cranial nerve known as the vagus nerve. It has two branches. One definitely is called as the RLN, that is your recurrent laryngeal nerve. Second is called as the SLN, that is your superior laryngeal nerve. Superior laryngeal nerve के दो branches होंगे बच्चे. One is the internal branch of superior laryngeal nerve. Second is the external branch of the superior laryngeal nerve. This internal branch of superior laryngeal nerve is also called as ILN, that is internal laryngeal nerve, and the external branch of superior laryngeal nerve is also called as ELN, that is external laryngeal nerve. Have you understood this? ये clear है? This is what is the nerve supply. Now, definitely हमने ये देखा कि the external branch of SLN was supplying the cricothyroid muscle. So what is the function of the internal branch then? Internal मतलब वो अंदर जा रही है larynx के. क्यों? क्योंकि उसको म्यूकोजा को सप्लाई करना है, उसको सेंसरी नर्व सप्लाई देना है. गॉट इट? सो द सुप्राग्लॉटिस इज सप्लाइड बाय द इंटरनल ब्रांच. ओके, इट इज सप्लाइड बाय द इंटरनल ब्रांच ऑफ द सुपीरियर लैरिंजियल नर्व और द एसएलएन. एंड इसी इंटरनल ब्रांच ऑफ एसएलएन को क्या बोल सकते हो बेटा? यू कैन इवन कॉल इट एज आईएलएन, दैट इज इंटरनल लैरिंजियल नर्व. गॉट इट? Next important beta, if I talk about the subglottis, yes, the part below the vocal cord. If I talk about subglottis, so which nerve definitely goes downwards into the chest, takes a turn, come back again? It is your RLN. इसीलिए तो उसको recurrent बोला जा रहा है. Recurrent मतलब क्या? जो वापस आता है. Recurrent means which comes again. So recurrent laryngeal nerve, it is called because it goes inside the chest, it takes a turn in the chest and it again comes back into the neck. Therefore, it is called as RLN or recurrent beta. So definitely, as subglottis is below, it is supplied by the RLN. It gets the sensory nerve supply from the RLN beta or the recurrent laryngeal nerve. Okay? And lastly, what is left? The third part, the glottis, that is your true vocal cords. So your glottis or the true vocal cords beta, these glottis or the true vocal cords, this will get the nerve supply from what? From both the nerves beta. Yes, the glottis or the true vocal cord, as they are in the center ना, तो उसको ऊपर वाली nerve से भी supply मिलेगा और नीचे वाली भी. So glottis or true vocal cords, as they are in the center of the larynx, they will get sensory nerve supply from both the nerves. That means the superior part of the vocal cords beta, the superior part of the glottis, will get the nerve supply from the internal laryngeal nerve. And the inferior part of the vocal cords or inferior part of the glottis beta gets the nerve supply from the recurrent laryngeal nerve. No issues till anybody? That is very clear. You will be like, sir, ये question भी आया है. That's the problem, that we think that only diseases come. No beta, there are a lot of questions of ENT anatomy which come in the examination. So please do focus on that. You actually flip through the pages directly. ये तो anatomy है ना, ये थोड़ी आएगा. Beta, these also come in the examination. There was a question recently that too in the examination which asked that the patient was having aspirations. वहाँ the question था. उसके आगे now the question was that the nerve which supplies the superior part of the vocal cords and the area above the vocal cord is which among the following nerves? इतना सीधा साधा सिंपल क्वेश्चन था, बट पीपल वर कंफ्यूज क्योंकि नर्व सप्लाई पढ़े ही नहीं थे, डायरेक्टली हमने पैथोलॉजीज पढ़ ली थी. सो प्लीज रिमेंबर बेटा, द अपर सर्फेस ऑफ द वोकल कॉर्ड एंड द एरिया अबव इट, दैट मींस द सुप्राग्लॉटिस इज सप्लाइड विद द ILN, इंटरनल लैरिंजियल नर्व. सो इट वाज एक्चुअली अ क्वेश्चन ऑफ ILN बेटा. ठीक है, याद रखना. इफ आई टॉक अबाउट दिस क्वेश्चन आउट हियर, देन वी विल डिस्कस अबाउट द first question that we have discussed. क्या था ये question? A 30-year-old singer beta underwent thyroid surgery few days ago and now presents with poor quality of voice. What is the cause? So for this you actually have to understand the types of muscles first, and then we already know the nerve supply. Let's talk about the types of muscles. So there are three types of intrinsic muscles inside the larynx. बच्चे, there are three types of intrinsic muscles or three groups of intrinsic muscles in the larynx. First group of intrinsic laryngeal muscle is called as the abductors. What do I mean by abduction beta? Towards the center or away from the center? Away from the center. बाहर की तरफ जो जाता है, that is abduction. So abductor muscles means the muscles which are going to open the vocal cords, right? Which will cause abduction of the vocal cord. So abductors means the muscles which will open the vocal cord beta, they are called as abductors. And this was again a previous year question, only one liner. There is only a single abductor in the larynx. बस एक abductor होती है larynx में बेटा. There is only one abductor of the vocal cord which will help open the vocal cord. That is called as PCA. What do I mean by PCA? Posterior cricoarytenoid muscle. Okay, that muscle is known as posterior cricoarytenoid muscle. Second important beta, that was abductors. That means the muscle which is going to open the vocal cord. Second group of muscle is known as adductors. What is adduction? I hope all of you are quite aware. Adduction means towards the center. Addition ना, ऐसे याद रखो. Adduction means towards the center. So adductor group of muscles are the muscles which will close the vocal cord or which will bring the vocal cord towards the center, right? So adductor group of muscles क्या करते बेटा? Adductor group of muscles will close the vocal cord. ठीक है? And important is you have to remember that these adductor group of muscles which are there, they are 4 in number. 4 adductor muscles होती है बेटा. One muscle is called as the thyroarytenoid muscle. ऐसा नाम क्यों? Because it starts anteriorly from the thyroid cartilage and it ends posteriorly on the arytenoid. तो इसलिए it is called as thyroarytenoid muscle. Second muscle बेटा, interarytenoid muscle. कितने arytenoid cartilages थे अपने पास? We had 2 arytenoid cartilages. So a muscle which is going to connect both these arytenoid cartilages will be called as interarytenoid muscle. Then the third one beta is the LCA. What is LCA? LCA is nothing else but lateral cricoarytenoid muscle. LCA is nothing else but lateral cricoarytenoid muscle. ठीक है? And last one, the muscle which was always an exception. What was that muscle which was always an exception? Cricothyroid. So the fourth adductor muscle which will close the vocal cord is cricothyroid muscle. So there are 4 adductor muscles which will actually close the vocal cord. First is thyroarytenoid, second is interarytenoid, third is lateral cricoarytenoid, and the fourth is cricothyroid muscle. Got it? And last group of muscle, the third group of muscle is called as tensors. Now what is tensors actually? नाम से ही पता चल रहा है. They are going to tense something. That means they are going to stretch something. किसी ना किसी को खींचेंगे. किसको खींचते हैं वो? Vocal cords को. Got it? So why do we need to stretch the vocal cord? Why do we need to tense the vocal cord? तुमने कभी म्यूजिक इंस्ट्रूमेंट देखा? Have you seen a drum? ड्रम का जो मेम्ब्रेन होता है बेटा, have you seen that ड्रम का जो मेम्ब्रेन होता है, it is tight. क्यों? Because when the membrane of the drum is tight, then when we strike that drum बेटा, तब एक आवाज अच्छे क्वालिटी की निकलती है, राइट? और उसी अगर मेम्ब्रेन को तुम ढीला कर दो, लूज कर दो, तो अब ढंग से स्ट्राइक हो पाएगा क्या? नहीं. तो ढंग से वाइब्रेशन या साउंड प्रोड्यूस होगा क्या? नहीं. That is the reason beta, when we want good quality sound, okay, or good quality of voice from the vocal cords, these vocal cord membranes should be stretched out, okay, so तने हुए होने चाहिए, tensed out होने चाहिए, तभी एक better quality of voice आता है. ठीक है? So tensor group of muscles बच्चे, they are going to stretch the vocal cord. Okay, tensor group of muscles, they stretch the vocal cord. And why stretching vocal cords is important? To get a better quality of voice. So can I say that tensor group of muscles are responsible for the quality of voice? Right? And the tensor group of muscles, you have to remember beta, the main tensor muscle Again, a previous question. The main tensor muscle is nothing else but the exception muscle always, that is cricothyroid. So the main tensor muscle is nothing else but the cricothyroid. But अगर cricothyroid option में नहीं है तो, if they have asked that which among the following is a tensor muscle and you do not have cricothyroid in option, then another muscle which helps cricothyroid beta, and that is an accessory muscle called as vocalis. So you can even mark as vocalis. But main is always cricothyroid. If cricothyroid is not in option, then you can mark it as vocalis. And अगर vocalis भी नहीं option में तो, if vocalis is not in option beta, then you have to mark it as thyroarytenoid. Why? How I can mark thyroarytenoid? Because vocalis is nothing else but internal part of thyroarytenoid muscle. Okay, vocalis is nothing else but an internal part of thyroarytenoid muscle. So the main tensor muscle always cricothyroid. Not an option, go for vocalis as the answer. Not an option, go for thyroarytenoid as the answer. Got it? So that is important. Now you will understand it much better, beta. Okay? If I say that the patient underwent a surgery. Now a surgery, कोई भी neck surgery हो सकती है, any kind of neck surgery. Most commonly it is usually the thyroid surgery, beta. We know we have the thyroid gland in the neck, which is located in the middle or in the center of the neck exactly, right? And this thyroid gland which is there, when we operate on this thyroid gland, there is a potential or there's a risk that we are going to injure these nerves because these nerves are very close to the thyroid gland. For example, अगर ये तुम्हारी butterfly shaped thyroid gland है, just if this is your butterfly shaped thyroid gland beta, so just close to this thyroid gland, we have these nerves. On the superior pole of the thyroid gland, we have your superior laryngeal nerve, or to be specific, the external branch of superior laryngeal nerve. Okay. Whereas on the inferior pole of the thyroid gland, we have the recurrent laryngeal nerve. Okay. So superior pole of thyroid gland, right and left. Okay, right and the left, superior laryngeal nerve. And on the inferior pole of the thyroid gland, the right and the left, recurrent laryngeal nerve. Got it? So can I say this, that when we are operating on the thyroid gland, when we are performing a surgery on the thyroid gland, there is a risk we can injure the recurrent laryngeal nerve on both sides or the superior laryngeal nerve on both the sides? Yes. So yes, important is, yaad rakhna, one of the important complications of thyroid surgery is a bilateral SLN or a bilateral RLN injury. Okay? Because these nerves are very close to the thyroid gland. So while you are operating, there is a chance that by mistake you can injure these nerves as well. Okay? So now important is, the patient was undergoing a surgery beta, let's say thyroid surgery itself, and during the thyroid surgery he has got injury to his SLN. There was a bilateral SLN injury. Now when there was a bilateral SLN injury, what will be the problems that the patient is going to face? Let's see that. We know that SLN has how many branches, bache? The superior laryngeal nerve, it has two branches. One is the internal branch called as the internal laryngeal nerve, and second is the external branch called as the external laryngeal nerve. So let's first see, if the internal laryngeal nerve is damaged, what is going to happen? So if the internal laryngeal nerve will be damaged, where the internal laryngeal nerve was supplying? A recap. So we know that the internal laryngeal nerve was giving sensory nerve supply to the mucosa of supraglottis, right? So definitely if the internal laryngeal nerve is damaged, what happens? There is loss of sensations. Will there be any nerve to carry sensations now? No. So there will be loss of sensations. In which part of the larynx beta? Obviously in the supraglottis. So there will be loss of sensations in the supraglottis bache. There will be loss of sensations in the supraglottis. And मैंने बोला था, for example, a food material wants to enter inside the larynx beta. When this goes inside the supraglottis, immediately it is sensed, and in response to that a cough reflex is produced, and this foreign substance or food material is thrown out. So that is how aspirations are prevented. But if his internal laryngeal nerve has been injured beta, will there be any sensations in the supraglottis? No. If there are no sensations in the supraglottis, and if now a food particle tries to enter inside his supraglottis or inside his larynx beta, will that get sensed? No. Uska koi sensation hi nahi hoga. If there are no sensations itself, okay, will there be any cough reflex in response to that? No, if there is no sensation, तो कैसे cuff reflex आएगा? There is no cuff reflex also then. And therefore, this food particle or this foreign substance directly goes inside his larynx, and from there it goes inside his airway, even up till his lungs beta. And that is what is known as aspiration. Any foreign substance entering into the airway known as aspiration. So अगर there is loss of sensation from the supraglottis, can I say कि इस patient में बार बार aspirations होते रहेंगे? Can I say this patient is going to suffer from recurrent aspirations, right? That is the problem when the superior laryngeal nerve of the patient, or to be specific, the internal branch of superior laryngeal nerve has been injured. And this was the question which has been recently asked. यही बोला था उन्होंने कि internal laryngeal nerve, the recurrent patient is experiencing recurrent aspiration. Which nerve is likely to be injured? Answer was internal laryngeal nerve, right? Next important bit, if I talk about the ELN injury now. ELN is what? External laryngeal nerve. Okay, or the external branch of SLN. We know where does the ELN gives the nerve supply? We know beta, this ELN or your external laryngeal nerve, it is going to supply the cricothyroid muscle, right? All the other muscles are supplied by the RLN except the cricothyroid muscle, which is supplied by the ELN or the external laryngeal nerve. So can I say beta, whenever the external laryngeal nerve will be injured, the cricothyroid muscle will not get any nerve supply, and therefore the cricothyroid muscle will get paralyzed. यही होता है ना, cricothyroid muscle will not be able to contract and वो paralyze हो जाएगी, weak हो जाएगी, right? So as the external laryngeal nerve will be injured beta, there will be paralysis or palsy of which muscle? Cricothyroid muscle, right? External laryngeal nerve injury leads to palsy or paralysis of the cricothyroid muscle. And as there is a cricothyroid muscle palsy beta, what was the function of cricothyroid muscle? I hope all of you are quite aware now. The function of cricothyroid muscle क्या था? इधर हमने लिखा था ना, cricothyroid muscle, it also acts as an adductor muscle to close the vocal cord, but main function क्या था? Main function of cricothyroid beta, it is a tensor muscle, right? The main function of cricothyroid, it is a tensor muscle. And what is the function of tensor muscle? It will stretch the vocal cord, okay? And why stretching of vocal cord is necessary? To provide or to give better quality of voice. अब मैं बोल रहा हूं कि external laryngeal nerve has been injured, due to which the cricothyroid muscle has been paralyzed, okay? And if that cricothyroid muscle has been paralyzed, can vocal cords be stretched out beta? Vocal cords stretched out होंगे क्या अभी? नहीं, vocal cords stretched out नहीं रहेंगे. And if vocal cords are not stretched out, they will become loose, okay? ढीले पड़ जाएंगे. And when these vocal cords become loose beta, these are called as bowed down or loose vocal cords. That will lead to bowed down or a loose vocal cord. So these vocal cords will become something like this, झुके हुए, right? They will be bowed down or loose vocal cord. And as I've told you beta, in a drum, if the membrane is loose, the quality of voice will be good or bad? Obviously bad. Just like that, if your vocal cords are loose beta, okay, even if there is vibrations, कैसे vibrations होंगे? एकदम poor quality vibrations, right? So the sound will also, or the voice will also be of poor quality, right? So bowed down या loose vocal cords होंगे, इसलिए the patient will have a poor quality of voice, right? The patient will have a poor quality of voice. So for example, the patient is a singer, the patient will not be able to take the high notes beta, okay? That will be the problem. So important is, if they say the patient is suffering from a poor quality of voice, you need to remember that means the main tensor muscle, that is cricothyroid muscle, has been paralyzed. And if that has been paralyzed, that means which nerve has been injured? The external laryngeal nerve has been injured. Okay? With this now, first answer this question. Question says a 30-year-old singer underwent thyroid surgery few days ago and now presents to you with poor quality of voice. What is the likely nerve injured? What is the cause? Which is the likely nerve injury, Biche? Type in the chat box once. Which is the likely nerve injury now? So please remember the likely nerve injury over here. We know poor quality of voice, hai na? So the likely nerve injury is going to be the external branch of the superior laryngeal nerve or external laryngeal nerve injury. So यहाँ पे the nerve which is injured is nothing else but the external branch of SLN or the external laryngeal nerve, we can call it. Okay? Answer this question, beta. Answer this question out here. What will be the answer to this question now? A patient underwent surgery for removal of a cystic mass in the neck. Post-operatively, the patient had aspirations without any change in voice. Voice was absolutely normal. If voice is absolutely normal, beta, okay, if voice is absolutely normal, was there any problem in the cricothyroid muscle? No. And if there is no problem in cricothyroid, that means there is no problem in the external laryngeal nerve also. So ELN is absolutely normal, right? So ELN is absolutely normal. Aspirations क्यों होते हैं patient में? We have discussed. Aspirations are there because there is loss of sensations from the supraglottis. And why does it happen? Because of injury to the internal laryngeal nerve. Shabash. So the likely cause in this condition, beta, is answer is what? Option B, internal laryngeal nerve palsy. Right? Answer over here is internal laryngeal nerve palsy or internal laryngeal nerve injury. Okay? याद रखना है बात. So you will be like, so why not superior laryngeal nerve? बच्चे, superior laryngeal nerve is the parent branch. उसके तो दो branches है ना. If superior laryngeal nerve would have been injured, even the ILN as well as the ELN both have been injured. दोनों paralysis हो जाता दोनों का. And अगर SLN की palsy होती है तो याद रखना, obviously there will be aspirations, but alongside there will be also poor quality of voice. तो याद रखना, SLN की अगर palsy होती है तो aspirations भी होंगे और साथ साथ quality of voice will also be poor. Okay, here they have said the quality of voice is absolutely normal, so that means ELN is absolutely normal, and if ELN is absolutely normal, we cannot say it is the palsy or injury to the superior laryngeal nerve. याद रखना है बात, ठीक है? So याद रखो, SLN में दोनों चीजें होती, voice would also have been poor and aspirations भी होता है, ठीक है? अगर बस aspiration लिखा है मतलब answer has to be option B. This is a recent exam question बेटा, ठीक है? चलो, important if I talk about the next question out here. What is that question saying? Here we have a question which states a neonate was brought to you by parents with, okay, complaints of noisy breathing beta. What is noisy breathing called as? There are, please remember, two types of noisy breathing. If there is obstruction of the upper airway beta, upper airway में क्या क्या आता है? For example, your pharynx, larynx, trachea, bronchi. ठीक है, ये upper airway हो गया. So if there is obstruction of this upper airway बच्चे, then the patient is going to have a noisy breathing called as a stridor. ठीक है, whereas if there is obstruction of the lower airway, अगर lower airway में obstruction है, lower airway मतलब your bronchioles, okay, so if there is obstruction of those small airways or your bronchioles beta, the lower airways, then the patient will have this kind of a voice while breathing, and that noise while breathing is called as wheezing बच्चे. So wheezing is due to obstruction of the lower airways and stridor is due to obstruction of the upper airway. Clear? Wheezing कौन से patients में दिखता है? Please write in the chat box once. Wheezing is a feature. Okay, wheezing is a type of noisy breathing seen in patients suffering from which condition? Please let me know that once. So here we have a neonate beta who was brought to you by parents with complaints of noisy breathing. On examination, you can see the stridor which is there. It increases when the child cries or lies in the supine position beta, and decreases when the child goes into the prone position. And laryngoscopy reveals there is a floppy epiglottis. Floppy matlab dhila, loose. Okay, that is a floppy epiglottis. What is the best treatment option in this condition? What is your diagnosis, anybody? Can you tell me the diagnosis? Neonate has been brought. Neonate matlab a child with just born. The first 28 days of life is called as neonatal period. So the child with just born, the first month, okay, has been brought to you with noisy breathing or stridor. This stridor increases in supine position or while crying and decreases in prone position. Laryngoscopy shows there is a floppy or a loose epiglottis. What is the best treatment option? What is your provisional diagnosis beta? Any time whenever there is a clinical case like this, you have to first of all you have to pick up the keywords. Question solve करने का तरीका होता है. Don't just solve questions. This is the pattern of solving question beta. What I have marked, these are the keywords in your question. Once you pick up these keywords, making a provisional diagnosis becomes easier. So what do you think is the likely diagnosis or the provisional diagnosis with the information that is highlighted? Okay, so the provisional diagnosis in a condition beta is the most common cause of stridor in a neonate, and the most common cause of stridor in a neonate beta is a condition known as laryngomalacia. Recent question also and has been repeated multiple times. मैं ऐसे questions को बोलता हूँ सरकारी. So this is one of the सरकारी questions of ENT बच्चे, and that condition is known as laryngomalacia. Let's discuss about that. If I talk about laryngomalacia beta, so what do I mean by malacia first of all? Okay, malacia का मतलब होता है weakness. Wherever there is malacia, for example osteomalacia, that is weakness of bone. Got it? तो वैसे laryngomalacia means weakness inside the larynx beta. And inside the larynx मतलब exactly कहाँ की weakness? So please remember, laryngomalacia beta, by definition it is nothing else but it is weakness. Okay, it is weakness of the supraglottis. Yes, it is actually the weakness of the supraglottis beta. Okay, so there is weakness in the supraglottis in this patient, and this condition beta is present since birth. Any condition that is present since birth is called as acquired or congenital? Congenital, right? So please remember, laryngomalacia which is there, it is the most common, it is the most common congenital anomaly. Okay, it is the most common congenital anomaly of larynx. याद रखना, laryngomalacia is a condition which is the most common congenital anomaly of larynx, which it is the most common congenital anomaly of larynx. याद रखने वाला. No issues till anybody? And lastly, you have to remember one more point, that it is the most common cause. It is the most common cause of stridor in neonates. I told you what is stridor. Stridor is nothing else but noisy breathing. So the most common cause of stridor in neonates beta is also a condition known as laryngomalacia. These are the points to be remembered. So most common congenital anomaly of larynx, if they ask you, answer has to be laryngomalacia. Most common cause of stridor in neonates, if they ask you, answer has to be laryngomalacia again. ठीक है, याद रखने बात. Now, what will be the complaint of the patient? क्या होता है यहाँ पे? मैंने बोला बेटा, laryngomalacia में there is weakness of the supraglottis. In supraglottis, I hope all of you are quite aware, we have that leaf-like cartilage which opens or closes the larynx. कौन सा था वो leaf-like cartilage? Epiglottis, right? So definitely यहाँ क्या होगा? If there is weakness of the epiglottis बेटा, तो epiglottis lose हो जाएगा और epiglottis नीचे गिर जाएगा. It will not be able to hold the position properly, and therefore it will fall down. Okay, the epiglottis actually normally it is leaf-like. Okay, normally it is leaf-like in shape beta, but as it becomes looser, it changes the shape. It falls down, it changes the shape, and now it becomes this kind of beta. And what is this shape called as? This is known as the omega shape beta. This is what is called as the omega shaped epiglottis. A very commonly repeated laryngoscopic picture in the examination is this. Okay, classical omega shaped epiglottis. देखते ही तुम laryngomalacia mark कर सकते हो बेटा. Yes, it is not seen in any other condition. So this is the omega shaped epiglottis. Because the epiglottis is very weak, it is very loose, therefore it is falling down and changing its shape beta. Okay, so that is what is seen. And now when the epiglottis will be loose beta, this is your larynx, ठीक है, और ये तुम्हारा epiglottis. What happens now? This epiglottis is becoming loose, it is falling down. Can you see when it is fallen down beta? It is closing the larynx. जब ये नीचे गिर जाता है लूज होने की वजह से या वीक होने की वजह से, it is actually closing the larynx. And when it is closing the larynx, it is actually causing obstruction in the larynx. Obstruction in the larynx means obstruction in the airway, and obstruction in upper airway leads to a noisy breathing, and that noisy breathing is known as stridor. Got it? Now, sometimes the stridor or that noise is only heard while inspiration beta. That will be called as an inspiratory stridor. If that noise is only heard during expiration, then it will be called as an expiratory stridor. And if that noisy breathing is heard both during inspiration as well as during expiration, then it is called as a biphasic stridor. ठीक है, तो याद रखना, there are three types of stridor बेटा. याद रखना, stridor is nothing else but noisy breathing, and that noisy breathing बच्चे is actually due to the obstruction of lower airway or upper airway. Noisy breathing of stridor is due to, okay, it is due to obstruction of the upper airways beta. Okay, okay, so that is important. Now there are three types of stridor I told you. One is definitely inspiratory stridor, when the voice or the noise only comes during inspiration. Second is definitely a biphasic stridor, when noise comes during inspiration as well as expiration. And third is an expiratory stridor, when the noise only comes during expiration. If I talk about inspiratory stridor, it is due to obstruction at which level beta? Inspiratory stridor comes if there is any obstruction at the level of the pharynx or at the level of the supraglottis. Okay? Biphasic stridor comes. So the sequentially jana hai beta. If there is obstruction in the pharynx or the supraglottis, inspiratory stridor. Then what comes is the glottis, subglottis, and the trachea. The part of the trachea which is present in the neck or the cervix will be called as cervical trachea. So if there is obstruction of the glottis, that is your true vocal cords, or at the level of the subglottis, or at the level of the cervical trachea beta, the patient is going to experience a biphasic stridor. And when the patient is going to have obstruction in the trachea which is present inside the chest or the thorax, so obviously the part of trachea in the thorax will be called as thoracic trachea. So if there is obstruction in the thoracic trachea or the bronchi beta, then it will lead to an expiratory stridor. So obstruction in the level at the level of thoracic trachea, obstruction at the level of the thoracic trachea or in the primary and secondary bronchi will lead to a expiratory stridor. Got it? So that has to be remembered. Now, please tell me in a case of laryngomalacia beta, which kind of stridor will be present? And this was a recent June 2023 question. ऐसे questions आते हैं exam में. ठीक है? So please remember beta, usually some questions are easy and ENT is the subject from which a lot of easy questions usually come. Okay, barring one or two, most of the questions are going to be easy out of the 15 or 17 questions which come. So please tell me by the list that you have in front, which kind of stridor will be seen in a patient of laryngomalacia? Inspiratory, biphasic or expiratory beta? Hopefully now it's very clear. Very good. It is the inspiratory stridor. And this was the question. Straightforward इतना ही पूछा था. ठीक है? So in a patient of laryngomalacia, we know beta, the obstruction is at the level of the supraglottis. And हमें पता है when supraglottis undergoes obstruction, it will lead to an inspiratory stridor. So the main complaint of the patient in laryngomalacia is nothing else but beta an inspiratory stridor itself. Yes, बाकी कोई दिक्कत नहीं होती patient में और neonate में. Okay, there is an inspiratory stridor in the patient. That's it. Now, what is special about this inspiratory stridor? First thing, beta, you have to remember that this inspiratory stridor will be present in the first week of life itself. Yes, the child or the neonate will be brought to your OPD in the first week of life itself. एक हफ्ते का या एक महीने का बच्चा होता है बस बेटा. ठीक है? So it presents. Okay. So please remember this inspiratory stridor which is there, beta. It presents in first week of life. It presents in first week of life. First important point to be remembered for this. Second important point now, it increases in supine position or during crying. क्यों? समझ लो बेटा एक बात. Now for example, if I talk about this is your larynx. ठीक है? Larynx एक cylinder है मैंने बोला था खाली, right? And this is your epiglottis. Now what happens? When you lie in supine position, what do I mean by supine position? I hope all of you are clear. Supine means your face is facing towards the roof. मुंह ऊपर की तरफ है बेटा. Right? That is called a supine position. When you lie in supine position, ये देखो क्या हो रहा है. हमें पता है कि epiglottis is anterior बेटा, या anterior epiglottis. ठीक है? Now जब तुम supine position में सो रहे हो, see you are lying supine. तो क्या हो रहा है? Definitely the epiglottis is closing the larynx बेटा. Epiglottis is closing the larynx. And when epiglottis will close the larynx बच्चे, please tell me obstruction will increase or decrease? Obviously the obstruction is going to increase, and जब obstruction will increase beta, obviously the stridor is also going to increase. The noise will also increase beta. Got it? So therefore whenever the child lies in supine position, the stridor or that noise which is there beta, it is going to increase usually. Got it? तो याद रखना. Whereas जब बच्चा रोता है तब भी larynx बंद हो जाता है. Why? Because we don't want any kind of aspiration. तो इसीलिए जब बच्चा रोता है बेटा, obviously the larynx is going to close. Okay, and as the larynx will close, the obstruction will increase, and due to that definitely the stridor will also increase. So the stridor increases in supine position or while crying. One thing. Second, जब बच्चा उल्टा सोता है बेटा, when the child lies on his tummy, that means the face facing downwards, नीचे की तरफ देख रहा है, तुम पेट के बल सो रहे हो. So when the child lies in prone position, क्या हो जाएगा? Can you see the epiglottis falls back? Can you see beta? The epiglottis usually falls back over here, right? When the child lies in prone position, the epiglottis falls back. And as the epiglottis is falling back beta, can you see the obstruction is decreasing? The larynx is opening up more. And जैसे larynx ज़्यादा open हो जाएगा बेटा, okay, obstruction कम हो जाएगा, obviously the stridor is also going to decrease. ठीक है? तो याद रखना important point, whenever the child lies in prone position, पेट के बल सोएगा, epiglottis will fall back, the larynx will open up, the obstruction will decrease, and therefore the stridor will also decrease beta. ठीक है? So important points that you have to remember about this inspiratory stridor, that it increases, okay, it increases in supine position, it increases in supine position or while crying beta, or on crying. First point. Second point to be remembered, it decreases in prone position. It decreases in prone position beta. This is a very important thing to be remembered. Okay? Whereas if I talk about, what about the voice of this child? बच्चा रोएगा ना तो रोने की आवाज ठीक होगी क्या? Yes, because voice is not produced by the supraglottis बेटा. यहाँ पे दिक्कत कहाँ थी? Supraglottis में थी ना. Voice is not produced by the supraglottis. Voice is produced by the glottis. That is your true vocal cord. True vocal cord या glottis में कोई दिक्कत है क्या? नहीं है बेटा. That is the reason the cry sound of the baby is going to be absolutely normal बच्चे. ठीक है? तो याद रखना, there will be only stridor, but the cry sound of baby बेटा, the cry sound of the baby which is there is going to be normal. ठीक है? And that is a hint. That means the vocal cords are not affected. Only the supraglottis is affected बेटा. ठीक है? So that is a hint towards laryngomalacia. When I do a laryngoscopic examination, okay, so please remember we will do a laryngoscopic examination. Endoscope डालेंगे अंदर एक, and then we will visualize this larynx. When we will do this laryngoscopic examination, क्या दिखेगा? The epiglottis is very weak, it is loose, it has fallen down, it has changed its shape. So on examination, we'll be able to see beta. On examination, we'll be able to see which shape of epiglottis. Very characteristic keyword. There is a omega shaped epiglottis. Now, are they going to write always omega shape beta? No. Sometimes if they don't want it to make it easier for you, वो उसके जगह बस दूसरा term use कर लेंगे, that is floppy. Floppy means weak and loose. ठीक है? So they can write also it is a floppy epiglottis. Both mean same thing. So omega shaped epiglottis या floppy epiglottis they'll write पीछे. ठीक है? तो omega shaped or a floppy epiglottis will be seen on laryngoscopic examination in a child suffering from which condition? Laryngomalacia. Got it? So that is important. Now what should be the treatment in the child? What should be the treatment in the child? What is your answer? This is the same answer for your question also beta. Question में भी यही पूछा था ना. Neonate brought to you by parents with complaints of noisy breathing. Stridor increases when child cries or in supine position, decreases on prone position. Laryngoscopy showing floppy epiglottis, that is omega shape. Best treatment option. Diagnosis हमारा पता है हमें laryngomalacia है. What is the treatment option? What do you think? चलो तुम्हारे सामने options है 4. What do you think beta? So this has been a very commonly repeated question. Commonly repeated image based question is that omega shaped epiglottis. Common case is laryngomalacia for diagnosis. Stridor का भी question पूछा जा चुका है. And last important, they have asked about treatment. August 2020 and after that once. Twice repeated since August 20. क्या बेटा treatment? Treatment is nothing else but reassurance. Reassurance मतलब कुछ नहीं करना है. You just have to tell the parents of the baby that ये condition जो है ये self limiting है. This condition is self limiting. It will improve with time. ये टाइम के साथ ठीक हो जाएगा बेटा, कोई दिक्कत नहीं है. सो रीअश्योरेंस किसको, बच्चे को दोगे या पेरेंट्स को? ऑब्वियसली पेरेंट्स को. सो रीअश्योरेंस टू पेरेंट्स बेटा इज द ट्रीटमेंट. और अगर ये ऑप्शन में नहीं होगा, समटाइम्स रीअश्योरेंस इज नॉट देयर, देन यू कैन मार्क इट एज नो ट्रीटमेंट. यस, नो ट्रीटमेंट हैज टू बी डन. और अगर ये भी नहीं है ऑप्शन में, यू कैन मार्क इट एज कंजर्वेटिव मैनेजमेंट और वेट एंड वॉच. ठीक है, कंजर्वेटिव मैनेजमेंट, वेट एंड वॉच कुछ भी होगा तो दैट should be marked as answer. अगर reassurance नहीं है, first priority for options is always reassurance बेटा. अगर है option में तो reassurance नहीं है तो no treatment, wait and watch, conservative management कुछ भी mark कर लो. But till what time? कब तक ठीक हो जाना चाहिए? This condition, as I told you बेटा, reassurance is the treatment because it is self-limiting condition, as I told you. Okay, it is a self-limiting condition. But till what time it should resolve? कब तक ठीक हो जाना चाहिए? It should resolve by the time of 2 years बेटा. जब तक बच्चा 2 साल का हो जाता है तब तक ये कंडीशन ठीक हो जानी चाहिए. Okay, so it should resolve by the time of 2 years. But if it is not resolved in a span of 2 years, then तब क्या करोगे? Please remember, after 2 years of age बेटा, okay, reassurance should be marked as the answer up till 2 years of age. After 2 years of age बेटा, still symptom persist. Symptom persist मतलब अभी भी symptoms बरकरार है. ठीक है. So after 2 years of age also, if still the symptoms persist बेटा, then we have to go for a surgical management. And वो surgery क्या करेंगे? हम अभी epiglottis को fix करेंगे बेटा with the help of suture, so that वो गिरे नहीं बार बार, an obstruction ना cause करे, तो stridor नहीं होगा. And second, और या फिर हम रिपेयर करेंगे सुप्राग्लॉटिस को। एक ही बात होती है, एक तो एपिग्लॉटिस को फिक्स कर रहे हैं या फिर हम बोलेंगे हम रिपेयर कर रहे हैं सुप्राग्लॉटिस को। नाउ फिक्सेशन को क्या बोला जाता है सर्जरी में? फिक्सेशन इज नोन एज पेक्सी बच्चे, एंड हम एपिग्लॉटिस को फिक्स करेंगे तो उसको क्या बोला जाएगा? एपिग्लॉटोपेक्सी, राइट। हम एपिग्लॉटिस को फिक्स करेंगे तो उसको क्या बोला जाएगा? एपिग्लॉटोपेक्सी। या फिर रिपेयर या रिकंस्ट्रक्शन को क्या बोलते हो? रिपेयर और रिकंस्ट्रक्शन इन सर्जरी इज कॉल्ड एज प्लास्टी बेटा, ठीक है। रिपेयर या रिकंस्ट्रक्शन को बोला जाता है प्लास्टी। और किसकी रिपेयर कर रहे हो? सुप्राग्लॉटिस की, सो दैट कैन बी कॉल्ड एज सुप्राग्लॉटोप्लास्टी, ठीक है। सो इफ द child of laryngomalacia, his symptoms do not improve until 2 years of age, after 2 years of age you have to go for a surgical management, and that surgical management is either called as epiglottopecsy or a supraglottoplasty. Got it? Done with this. Now coming back to the question, answer your question now. इस बच्चे में क्या करोगे? Both the options are there. One is supraglottoplasty, second is reassurance to parents. Laryngotracheal reconstruction is usually done in a case where there is narrowing the larynx beta. Larynx narrow होता है, that is called as subglottic stenosis. So in cases of subglottic stenosis, we go for laryngotracheal reconstruction बच्चे. CO2 laser excision. CO2 laser excision is a surgery with the help of an invisible laser, that is a CO2 laser. We are going to remove something from the larynx. So like it can be used in early stages of cancer. It can be used for vocal nodules, okay, sorry, vocal polyps. So these conditions can be used a CO2 laser. So what is your answer beta? Option A or option D? Please answer in the chat box jaldi. Hopefully it is very clear, right? The child is a age, देखो, the child is a neonate beta, and I told you this condition is self-limiting until 2 years of age. 2 साल तक ठीक हो जाएगी अपने आप। तो here answer should be option D बच्चे, very good. The answer should be option D, reassurance to parents. अगर if they would have said that the child is 3-year-old, then obviously my answer would have been option A beta, but as here the child is less than 2 years of age, my answer has to be option D, reassurance. ठीक है, very good. Moving further, answer this question beta over here. What is this question saying? A weightlifter presents to you with a cystic neck swelling on the lateral aspect of the neck. Okay, on lateral aspect of the neck beta there is a swelling, and cystic मतलब मैंने बोला था sac which contains something, air, fluid, कुछ भी हो सकता है उसमें. That sac is called as a cyst. So here, just like a cyst, there is a neck swelling on the lateral part of the neck. Okay, since the last few there is lateral neck swelling beta. Since the last few months, on pressing, hissing sound is heard. जब भी तुम swelling को press करते हो, this kind of a sound comes. Okay, hissing sound is heard. An X-ray has been performed beta, which has been given below. What is the likely diagnosis of the patient? X-ray पे क्या दिखा रहा है? You are able to see on X-ray beta, in the lateral part of the neck, there is a swelling or there is a sac which is appearing black in color. What appears black on a X-ray beta? Fluid or air? क्या ब्लैक दिखता है एक्सरे पे, फ्लूइड या एयर? आई होप सो यू आर वेरी क्लियर अबाउट दैट. एयर अपीयर्स ब्लैक ऑन एक्सरे, बराबर. सो दिस स्वेलिंग और दिस सिस्ट इज एक्चुअली हैविंग एयर इनसाइड इट. तो ये एयर फिल्ड स्वेलिंग है बेटा, किसी टाइप की है, एयर फिल्ड सिस्ट है, ठीक है. तो इसीलिए जब प्रेस करते हैं तो एयर बाहर जाती है, एंड व्हेन दैट एयर एस्केप्स आउट फ्रॉम द स्वेलिंग इट मेक्स अ हिसिंग साउंड, ठीक है. That is important. This is another सरकारी question of your examination बच्चे. Okay, likely diagnosis नहीं, likely treatment होना चाहिए question. Okay, this is another सरकारी question of your examination बच्चे, and that is nothing else but a condition known as laryngocele. ठीक है, तो याद रखना, this is a very important condition बच्चे called as laryngocele. Now इसी में नाम में ही सब कुछ है बेटा. seal मतलब cavity. Yes, seal का मतलब होता है cavity या sac, ठीक है. तो यहाँ पे laryngocele means there is a sac or there is a cavity which is formed inside the larynx, ठीक है. Now I hope all of you are quite aware. We have discussed about supraglottis, तुम्हें याद होगा. Okay, these were the true vocal cord, these were the false vocal cord. दोनों के बीच की जो जगह थी that was our ventricle, and from the ventricle this outpouching which was arising what's called as the saccule beta. Now our focus should be towards the saccule. क्या होता है? See, whenever बेटा some person is blowing a lot of air, okay, कोई इंसान है जो बहुत ज्यादा हवा फूकता है. फॉर एग्जाम्पल अ पर्सन हु प्लेज विंड इंस्ट्रूमेंट्स. विंड इंस्ट्रूमेंट्स मतलब दोज इंस्ट्रूमेंट्स वेर यू नीड टू ब्लो एयर. जो इंस्ट्रूमेंट्स जिसमें म्यूजिक इंस्ट्रूमेंट्स में तुम्हें हवा फूकनी पड़ती है, लाइक ट्रम्पेट्स, सैक्सोफोन, राइट. usually Shehnai, these are the instruments beta. What happens due to that? There is a lot of pressure inside his larynx all the time. This patient is a trumpet player or a Shehnai player for almost last 20 years beta. So he has been blowing definitely a lot of air. So there is always a constantly increased pressure inside his larynx. उसके larynx के अंदर हमेशा pressure बढ़ा हुआ रहता है. And as there is too much of pressure inside his larynx, बच्चे, as there is too much of pressure inside the larynx, क्या होता है? A lot of pressure is also there on the saccule beta. There's a lot of pressure on the saccule also. And जिसकी वजह से what happens? This saccule which is there beta, due to this constant, okay, and repeated pressure, this saccule undergoes abnormal dilatation. देख सकते हो? This saccule undergoes abnormal dilatation. ये saccule फूल जाती है बेटा. That is what is called as a laryngocele. Yes, abnormally dilated saccule is what is known as a laryngocele beta. ठीक है? So that has to be remembered. So please remember in this condition, laryngocele, it is nothing else but, if I write down what it is a cystic neck swelling. Not necessary that always it will present with a neck swelling. Please remember that externally a swelling will not be visible always. If it is very small, maybe the swelling is not visible from outside also sometimes. Okay? So it is a cystic neck swelling due to, what is the main reason? Due to abnormal dilatation of which structure inside the larynx beta? Due to abnormal dilatation of saccule. So it is cystic neck swelling due to abnormal dilatation of saccule. So the main definition we can say, it is abnormal dilatation of saccule. Why does this happen? Due to constantly high pressure inside the larynx. Okay, so please remember the cause for this condition, cause for laryngocele, is nothing else but increased transglottic air pressure beta. Okay, around the vocal cords the air pressure is very high. So it is due to increased transglottic air pressure, due to high air pressure beta inside the larynx. In which patients it will be commonly seen beta? कौन से ऐसे लोग हैं जिनमें air pressure larynx के अंदर ज़्यादा होगा? There will be high air pressure inside the larynx. As I told you, the people who usually play wind instruments, right? उनमें ज़्यादा होता है. So definitely if they ask you, it is more commonly seen in. So please remember beta, it is more commonly seen in wind instrument players. As I told you, wind instrument means examples like trumpet, saxophone, shehnai, okay, all these instruments. So it is usually seen or more commonly seen in wind instrument player. तुम्हारा examiner is in love with trumpets beta. Therefore he always writes a trumpet player presents to you. But is it necessary that he will always write trumpet? No. तो इसलिए बाकी चीजें भी याद रखना बेटा. ठीक है? And second, people, तुमने देखा होगा बेटा, when weightlifters also, when weightlifters lift the weight, they actually fill up a lot of air in their larynx beta. Right? So उसकी वजह से भी बहुत ज़्यादा pressure पड़ता है. So definitely not only wind instrument players but even weightlifters are at a risk of developing laryngocele beta. So one is wind instrument players, specifically trumpet players, and second weightlifters. These are the two categories of patient which can actually have beta, which can actually develop laryngocele. Okay? Now what is the complaint of the patient? The main complaint of the patient, if it is large in size, the main complaint of the patient is only a swelling beta. And that to which kind of a neck swelling? Middle or lateral? A lateral neck swelling. Please remember which kind of a neck swelling? The patient is usually going to have a lateral neck swelling. ठीक है, तो याद रखना. The chief complaint or the main complaint of the patient is nothing else but a lateral neck swelling beta. Will the patient have any effect on the voice that he produces? No. Why no effect on the voice? Reason is बच्चे, please remember, जब voice production होता है, that is done by the true vocal cords or the glottis. Here there is no problem associated with the true vocal cords or the glottis. That's the reason his voice is not going to be affected much. ठीक है? So the patient, yes beta, there are two saccules in anatomy. Okay, there are two saccules usually in anatomy. Anatomy नहीं, ENT में ही दोनों saccules है बेटा. ठीक है, एक saccule larynx में होता है, the other saccule is usually present inside the inner ear. It is a vestibular organ responsible for the linear balance, utricle and saccule. ठीक है, so chief complaint की अगर मैं बात करूँ बेटा, तो please remember here the patient is going to present you with a lateral neck swelling usually. Okay, that is the problem. Now on examination, what is seen? Very important finding, very important sign beta. When you press this neck swelling, इस saccule के अंदर, इस sac के अंदर जितनी भी हवा है वो सब बाहर चली जाएगी. Right? When you press the neck swelling, all the air inside this saccule or the laryngocele beta, it will escape out, and then it will make which kind of a sound? hissing sound, and this is classically called as which sign? This is classically called as your Brice sign, bachche. This is classically called as the Brice sign. Okay, so on pressing neck swelling, there is a hissing sound which comes. Okay, on pressing the swelling, there is hissing sound. Now another question to you, bacha, that is, on pressing the swelling, on pressing the neck swelling, if there is a gurgling sound, gurgling matlab something like this, that is known as which sign, and it is seen in which condition? Please let me know that in the chat box. On pressing neck swelling, there is a hissing sound which comes due to escape of air. This is called as the Brice sign, which is a classical feature seen in patients of laryngocele, beta. Classical feature seen in patients of laryngocele. हाँ, larynx anatomy में दो saccule होंगे ही बेटा. One on this side, other on this side. Yes, there are two saccules which can be there. So laryngocele can also be bilateral. ठीक है, याद रखना. Please tell me, anybody. Hopefully you are able to answer. So याद रखना, when I press the neck swelling beta, when I press the neck swelling, and on pressing neck swelling, there is a gurgling sound. That is due to escape of fluid beta, and that is because there is a outpouching from the pharynx or outpouching from the esophagus, and that condition is what is called as the Zenker's diverticulum beta, and that is what is known as the Boyce sign. ठीक है, तो याद रखना है, क्लोज डिफरेंशियल है, गड़बड़ाना मत. Boyce sign which is there beta, BOYCE. Okay, Boyce sign is important from surgery as well. So Boyce sign which is there beta, it is nothing but on pressing neck swelling. Okay, so on pressing the neck swelling, there is which kind of a sound? Hissing or gurgling? There will be a gurgling sound which will come, and that is due to escape of air or fluid. That is due to escape of the fluid beta. From what? From the outpouching of the pharynx or the esophagus. So for example, this is your esophagus beta, and from there we have this outpouching known as Zenker's diverticulum. तो यहाँ पे अगर fluid जमा है, and when you press the swelling and this fluid goes out, it will make the gurgling sound. समझ आया? That is called as a Boyce sign. So Boyce sign is a feature that is usually seen in a condition known as Zenker's diverticulum, or we can call it as the pharyngeal pouch. ठीक है, याद रखना है. Don't get confused with Brice sign of laryngocele. ठीक है, important is this is the Brice sign bit on examination. Now further for investigation, what we are going to do? For further investigation, what are we going to do? Now here there is collection of air beta. It is a air filled neck swelling, right? और air देखने के लिए the best investigation is usually a X-ray, which is first line, and better than that we have a CT. So we can do a X-ray neck or we can do a CT neck. Yes. So after examination we will go for investigations, and in investigations you have to remember this you are able to see is a X-ray. On X-ray you are able to see there is definitely this laryngocele, air filled swelling which is appearing, and this is a CT beta. Again you are able to see this laryngocele over here as well. Okay? Important is, please remember that when we do this X-ray or CT for a case of laryngocele beta, we will ask the patient to perform a maneuver. क्या maneuver होता है? We will ask the patient to inspire deeply. Yes, बहुत ज़्यादा हवा भरने के लिए बोलेंगे पहले. We will ask the patient to deeply inspire, and then we will ask the person to expire with a closed nose and a closed mouth beta. पेशेंट को नाक और मुंह बंद करके सांस छोड़नी है. When the patient will expire with a closed nose and a closed mouth, where will all that air go? All that air will go beta inside this ventricle, and from there inside this abnormally dilated saccule. And when a lot of air will go inside this dilated saccule beta, that saccule will become much more prominent और अच्छे से दिखेगा, right? It will become much more prominent because more air is going inside it, and then you will be able to see it clearly on the X-ray or the CT. And this maneuver where you ask the patient to forcefully expire with a closed nose and a closed mouth is what is called as Valsalva maneuver. ठीक है? Very good. So investigations में you have to ask the patient to undergo a X-ray neck with which kind of a maneuver? With the Valsalva maneuver beta. So X-ray neck with the Valsalva maneuver to make the saccule or the laryngocele much more prominent. And for a better investigation than X-ray, we always have a CT neck which will be done. Okay. Once the diagnosis has been done with the help of the X-ray neck beta or with the help of the CT neck, what is the treatment to be done in this condition? Now the treatment to be done in this condition beta, as the saccule is abnormally dilated once, it is not going to come back into its normal size beta again. Therefore, the best treatment over here is nothing else but surgical excision. The best treatment for this condition is nothing else but surgical excision. Okay, so please remember. So how many questions have been asked from this? Obviously, they have given a clinical case saying a trumpet player comes to you, right? So diagnosis has been asked. Second, image-based questions with the help of giving X-ray or a CT has been asked earlier in the exam. Okay. Third, definitely they have even asked you about the Brice sign, and fourth, they have asked you about surgical excision. These whatever are highlight beta, they are actually the important points in the examination. Okay. So these have been asked, and therefore I call it Sarkari. So many questions and repeatedly asked. So now weightlifter presents you with cystic neck swelling on the lateral aspect of the neck since few months. On pressing the neck swelling, there is a hissing sound which is heard, and that we know is nothing else but your Brice sign that is seen in the patient. X-ray has been performed, which has been given below. It shows you a black colored sac, that means an air filled sac in the lateral part of the neck, and that, as we know, is nothing else but a case of a laryngocele. So the provisional diagnosis here is a case of laryngocele. And what is the treatment now? Answer me. Very good. Yes, all of you are right. Answer is option C, surgical excision beta. Please remember, Dohleman's procedure is a treatment where we actually place stapler between the Zenker's diverticulum and the esophagus, and we open the Zenker's diverticulum into the esophagus. It's called as diverticuloesophagostomy. That is the treatment option for Zenker's diverticulum or the pharyngeal pouch. Cyst trunk operation beta is a treatment that is done for a condition known as a thyroglossal cyst. When the patient is going to come to you with a midline neck swelling, lateral midline neck swelling, okay, that condition is known as thyroglossal cyst, when there is collection of fluid inside the thyroglossal tract, and that leads to a midline neck swelling. Usko nikalne ke liye, to remove the thyroglossal cyst, to remove the thyroglossal tract and a part of hyoid bone, that surgery is called as a cyst trunk surgery or cyst trunk operation, that is done for a thyroglossal cyst or even for a thyroglossal fistula as well. Okay? And lastly, chemoradiation is done for cancers beta. Here it is not a case of cancer. Okay? Next question beta. This is important from larynx as well, and this, as I told you, CA larynx I'll be discussing with other cancers which are important. One session will do only on cancers beta. CA larynx, CA breast and CA cervix. These are the most important cancers from all your syllabus, from whatever subjects they are. Okay, याद रखना. So definitely the cyst is slightly movable beta, ज़्यादा movable नहीं होता क्योंकि sacule is fixed ना, sacule यही होता है, so that is not very movable, but you can slightly fluctuate it. So definitely it is a fluctuant swelling, we can say, not movable, but it is a fluctuant swelling, you can say. Okay. Next question beta, it states a teacher has been taking frequent, long and uninterrupted sessions before the final examinations of students beta. He has been complaining of hoarseness of voice. Okay, hoarseness is very rough voice. Okay, the patient will have a very hoarse kind of a voice. This is called as hoarseness of voice beta. For the last 1 month now, and says two different frequency sounds are also heard. What is two different frequency sound? Same person at same point of time is able to produce two different frequencies of sound. Okay, अलग अलग frequency के sound same person से सुनाई दे रहे तुम्हें. That is what is called as diplophonia बच्चे. This symptom of the patient when two different frequency sounds are heard from the same patient picture, that is called as diplophonia. Right, double vision को diplopia बोलते हो ना. So just like that, double frequency sounds is called as diplophonia. So whenever she speaks now, whenever he speaks now, his laryngeal endoscopy beta, okay, his laryngeal endoscopy picture has been given below in the image. What will be the best management for this patient? Please make a provisional diagnosis for this condition. Anybody? Please make a provisional diagnosis for this condition. This is the laryngoscopic picture beta. This is the laryngoscopic picture. Please make a provisional diagnosis with the help of the keywords map and with the help of the image which is given of laryngoscopy. Please remember beta, it is not a vocal nodule actually. Okay, let's discuss about these two things and then I'll come back. Okay, so if I talk about two conditions which are very close differentials of each other, one is called as vocal nodules beta and the second is called as a vocal polyp. Now what is the difference? Let's see that. One is called as a vocal nodule, second is called as a vocal polyp. Vocal nodules are also called as beta teacher's nodules. Yes, vocal nodules, they are also known as teacher's nodules. Second, they are also called as singer's nodules. Third, they can also be called as screamer's nodules. Screamer मतलब जो चिल्लाता है. What is actually very common in between all these three? Teachers हो, singers हो, या फिर screamers हो बेटा. Like the street vendors who sell vegetables and all, they shout a lot, right? All these three people shout a lot, or they scream a lot, or they actually use their voice a lot, beta. They use their vocal cords too much. That is what is called as a vocal abuse, beta. And this vocal abuse is the main cause for development of vocal nodules. Okay, if there is a lot of shouting, screaming, or talking on a daily basis for a very long period of time, beta, that is called as vocal abuse, and that is the main reason or the main cause behind vocal nodules. Okay, therefore it can also be referred to as teachers, singers, or screamers nodules, because obviously vocal abuse will be common in these professions or these people, right? So please remember, vocal nodules, teachers nodules, screamers nodules, singers nodules, the most common cause for it is vocal abuse. Okay, but apart from vocal abuse, are there any other causes? Yes, beta. Apart from vocal abuse, there are other causes also. Like, one of the important causes always is smoking. A lot of voice disorders, problems that you have in larynx, one of the leading reasons for it is smoking, biche. Other reason, anybody? Will be there any other reason? Yes. For example, if esophagus pata tumhe, and esophagus is connected to the stomach, that we know. So जब lower esophageal sphincter, when that lower esophageal sphincter बेटा, वो दरवाजा जो esophagus का होता है stomach के साथ, when that lower esophageal sphincter relaxes again and again, what happens? Due to that, the acid of the stomach comes back inside the esophagus. Okay, that will be called as the gastroesophageal reflux disease, when the acid of stomach comes into the esophagus. But when that acid of the stomach beta, due to more and more reflux, starts coming inside the larynx and pharynx, when that acid of the stomach starts coming inside the larynx and pharynx, then it is called as LPR. What is LPR? Laryngopharyngeal reflux. So when that acid of the stomach starts coming inside the larynx and pharynx, causing LPR or laryngopharyngeal reflux beta, that acid also can cause damage to the vocal cords, and that can lead to formation of these vocal nodules as well. Can you see on this laryngoscopic picture on examination? There are two small nodules beta. Okay, so two small nodules or nodular elevations which are seen on both the vocal cords. Yes, on both the vocal cords, not one of them. And where they are actually present, these nodules or these nodular elevations, they are present. This is the anterior part of the larynx beta. This is the posterior part of the larynx. ठीक है? कैसे याद रखना है? The vocal cords, wherever they are narrow, the narrow junction is always anterior. ठीक है? So can you see these nodules are present at the junction of anterior 1/3 and posterior 1/3. They are more anteriorly, right? So they are present at the junction of anterior 1/3 and the posterior 1/3 of the vocal cords beta, posterior 2/3 of the vocal cords beta. Okay, that is the location of the vocal nodules. Why this is the location of vocal nodules? Because when you speak beta, when there is production of voice, okay, when there is production of sound, this junction is actually the most vibrating part of the larynx. So whenever there will be vocal abuse, this part will be vibrating again and again, and that's the reason beta, this is the most common site for development of the vocal nodules as well. Okay, so if they ask you which is the most common site for development of vocal nodules, remember it is nothing else but junction of anterior 1/3, okay, the junction of anterior 1/3 and the posterior 2/3 of the vocal cord. Junction of anterior 1/3 and the posterior 2/3 of the vocal cords beta. Reason being why it is so, why this is the most common site, reason is it is the most vibrating part. It is most vibrating part of the vocal cord. That's the reason. Okay, it is the most vibrating part of vocal cord. That's the reason it will be vibrating or damaged again and again. Got it? What will be the chief complaint? एक बात याद रखनी है बेटा, whenever there is any kind of problem or damage to the vocal cord, the main or the chief complaint of the patient is none other than hoarseness of voice. Patient की voice खराब हो जाएगी. So the patient is going to complain mainly of hoarseness of voice बच्चे. So the patient's main complaint is going to be hoarseness of voice. Got it? So the patient will have hoarseness of voice, that you have to remember. Okay, apart from that there is no other symptoms as such. Mainly there will be hoarseness of voice itself. Okay, now on laryngoscopic examination you will be able to see कि okay, there is nodular elevation small on both the sides in both the vocal cords, present at the junction of the anterior 1/3 and the posterior 2/3 of the vocal cords. Okay, this is a case of vocal nodules you are able to diagnose. But how to differentiate it from another condition, which is actually a condition known as vocal polyp? Yes, can you see? This condition is also at the same point or the same junction of anterior 1/3 and the posterior 2/3 of the vocal cord beta. It is also at the same site on the vocal cord. Okay? It is also the most common cause for this condition is also vocal abuse beta, chillana, okay, shouting, screaming, talking too much. The same reason will cause this vocal polyp itself beta. Okay? So how to differentiate? Two important factors to differentiate which is one factor it is that vocal nodules, if I say vocal nodules are always bilateral beta. Yes, vocal nodules are always bilateral. Vocal polyp is usually unilateral. One important thing to be remembered. And second important, vocal nodules which are there beta, they are usually smaller in size. Yes, they are very small in size. They are usually less than 3 millimeters in size. On the other hand, vocal polyp can be larger in size beta. Vocal polyp can be more than 3 millimeter in size. Okay? So one, nodules are always bilateral, and second, they are less than 3 mm in size. On the other hand, polyps are usually unilateral and they are more than 3 millimeters in size. Okay? ये दो points are to be remembered. Teachers देख के answer मत mark करना, that is important. What will be the treatment beta? Now treatment is definitely, as the patient's voice has become very hoarse, so you have to recommend the patient speech therapy. But are you going to recommend the patient speech therapy and are you going to ask the patient to speak a lot right now? No. Right now the patient actually needs some voice rest or some vocal rest, and after a few days definitely you will ask the patient to come back. You will send the patient definitely to a speech therapist. He will learn some exercises and that patient will actually learn how to speak without more strain on the vocal cords. Got it? So even if he is speaking for long hours beta, there will be less strain on the vocal cords. Okay? So the two primary management in a case of vocal nodules or teacher's nodules is voice rest and then followed by speech therapy should also be given. Okay? याद रखना है. Vocal polyp, if I talk about now, next condition which is a close differential diagnosis of vocal nodules. This vocal polyp, basically what is a polyp beta? सबको पता है that organs are going to have an inner lining and that inner lining is called as a mucosa बच्चे, right? तो जब उस mucosa में edema हो जाता है, what is edema? Edema is collection of fluid. So when there is collection of fluid or edema inside this mucosa beta, that mucosa will undergo swelling, and when that mucosa becomes too much edematous, when that mucosa starts hanging out, okay, so that hanging out, that prolapsed pedunculated mucosa is what is called as a polyp. Got it? जब mucosa में बहुत ज़्यादा edema हो जाता है and then that mucosa starts hanging out beta, it becomes like a pendulum, it starts hanging out, that is what is called as a polyp. So vocal polyp is nothing else but it is the prolapsed, that is लटकने वाला, pedunculated like a pendulum. It is a prolapsed, pedunculated, edematous mucosa beta of the vocal cord. It is prolapsed, pedunculated, edematous mucosa of vocal cord. That is what is a vocal polyp is. Second important, what is the most common cause? The same causes are going to cause vocal polyp itself. Yes. So the leading cause of vocal polyp is none other than bache, vocal abuse. The most common cause or the leading cause is vocal abuse itself. Apart from vocal abuse, the same other causes, that is nothing else but smoking, and second LPR, that is laryngopharyngeal reflux, right? Because obviously that acid or smoking acts as a damaging factors to the vocal cord, and if vocal cord is damaged, it will try to protect itself with inflammation, and जब inflammation होगा, one of the important signs of inflammation is edema, and when there will be too much of edema, that will lead to formation of a polyp. Got it? Site, as I told you, it is the same, that is junction of anterior 1/3 and the posterior 2/3 of vocal cord. So you can just write the site is same as nodules bache. Okay? What is the main complaint? So as vocal cords are damaged, the patient's main complaint beta, okay, the patient's main complaint is again going to be hoarseness of voice. Okay, so the patient's main complaint is again going to be hoarseness of voice itself beta. Apart from hoarseness of voice, will there be any other feature? Yes beta. And what is that? See, now when vocal cords are responsible for production of vibrations or sound, right? Now please tell me the vibrations that will be produced from this normal vocal cord will be of different frequency, and the vibrations that will be produced from this edematous mucosa or from this edematous vocal cord or the polyp will be of different frequency. So in the same person at the same point of time, are you able to hear two different frequencies of sound? बराबर वो बात करेगा बट एक ही साथ में अलग अलग दो फ्रीक्वेंसीज के साउंड सुनाई देंगे बच्चे, एंड दैट इज व्हाट इज कॉल्ड एज डिप्लोफोनिया. Got it? So please remember, patient will definitely have, or patient can definitely produce two different frequencies of sound at the same time, and these two different frequencies of sound is what is called as diplophonia. That is an extra feature in polyp beta which is never seen in a patient of nodule. Okay, that is important. अगर diplophonia दिया हुआ है, that means they are actually pointing more towards polyp than the nodules. ठीक है? And other factors to differentiate it from nodules, we always know that edema can be unilateral, polyp formation can be unilateral. So usually vocal polyps beta, they're unilateral. Nodules are always bilateral, but vocal polyps are usually unilateral. First thing. And second, we know beta, it is usually larger in size. You can see the polyp is much larger in size as compared to the nodules. So it is usually more than 3 millimeters in size. Usually, I'm saying again. So it is usually more than 3 mm in size. Okay, so these are the two important points to differentiate it from the vocal nodules beta. Okay, next important, what is the treatment now? So can you keep that polyp over there itself? We can't keep that polyp over there, right? हमें वो polyp उधर नहीं रख सकते. So we have to remove that polyp. And if you want to remove that polyp beta, if you want to remove that polyp, so क्या करना पड़ेगा? You have to operate with the help of a CO2 laser. CO2 laser is the most common laser used in ENT. ठीक है? So with the help of that CO2 laser beta, we can definitely remove that edematous mucosa or that polyp beta. And this surgery which is there beta, we have to do it under microscope. क्यों? Vocal cords are in millimeters beta. Okay, vocal cords are in millimeters. They are very small in size. So if you want to operate on them, you need definitely magnification, and for that you need microscope. So microscope के अंडर surgeries करी जाती है vocal cord की. Therefore that is called as MLS. That is nothing else but a microlaryngeal surgery बच्चे. So for treatment definitely we have to use MLS. That is a microlaryngeal surgery beta. And in that microlaryngeal surgery, what are we going to do? We are going to use a CO2 laser, and we are going to do incision or excision. Incision मतलब कट करना, ओके, एक कट मारना. एक्सीजन मतलब रिमूव करना. तो हमें क्या करना है? रिमूवल करना है. सो डेफिनेटली इट हैज टू बी CO2 लेजर एक्सीजन बेटा. सो आइदर ऑप्शन में होगा माइक्रोलैरिंजियल सर्जरी और दे विल राइट इट एज CO2 लेजर एक्सीजन. नो इश्यूज टियो, ठीक है. Followed by beta, whenever you have to do a surgery on the vocal cord, the vocal cords will get damaged and the patient might have some problems with the voice. So followed by microlaryngeal surgery or excisions, you always have to recommend beta speech therapy to the patient. Okay, patient might have some difficulties in speech. That's the reason you have to recommend speech therapy to the patient. And as I told you, you cannot say that to patient once he is operated and speech therapy is done, he will be absolutely fine, he will never develop polyps again. No, if he keeps on using his voice beta, okay, too much like he was using earlier, polyp will again develop, right? That's the reason one important advice that should be given to this patient also is vocal rest or voice rest beta. Okay, so microlaryngeal surgery is primary management done with the help of CO2 laser excision, followed by speech therapy along with voice rest should be recommended beta. Okay, now coming back to this question, what is your provisional diagnosis now? Please tell me, is it vocal nodules or vocal polyp now? Please tell me that. एनीबडी? टीचर है भले ही बेटा, टीचर है, बट टीचर का मतलब है उनका देने का कि दे आर टॉकिंग अबाउट वोकल अब्यूज. दे आर सेड आल्सो फ्रीक्वेंट लॉन्ग एंड अनइंटरप्टेड सेशंस द टीचर हैज बीन टेकिंग. ओके, that means they are talking about the cause, vocal abuse. But we know vocal abuse will not only cause nodules, it will also cause polyp. दोनों हो सकता है. देखते हैं आगे क्या बोला उन्होंने. कंप्लेनिंग ऑफ होर्सनेस ऑफ वॉइस. होर्सनेस ऑफ वॉइस इज अ कॉमन कंप्लेंट अगेन फॉर बोथ द कंडीशंस. ठीक है, but two different frequencies sounds, that means definitely diplophonia. We know diplophonia is pointing more towards the diagnosis of vocal polyp, right? Laryngoscopy की बात करें तो laryngoscopy पे क्या दिख रहा है? Junction of anterior 1/3 and posterior 2/3 of the vocal cord, right? The same site, but here it is only a unilateral elevation. We know nodules are always bilateral. This is unilateral elevation, one thing. and it appears more than 3 millimeters in size, and it looks out to be the edematous mucosa, that is nothing else but a polyp, right? So provisional diagnosis of this patient बच्चे is nothing else but a vocal polyp. समझ गए? तो टीचर देख के आंसर नहीं मार्क करना है. Okay, only teacher can be an important risk factor for a polyp too. Don't mark with that itself. ठीक है? So what is the best management बच्चे? They have asked what is the best management in the patient now. What is the best management of this patient? Can you tell me? Is it B or C? Please tell me that. Is it B or C? Vocal rest से पॉलिप अपने आप ठीक होने वाला है क्या? नहीं होने वाला बेटा, right? Vocal rest will be given, will be advised. Okay, that will be advised, but will the patient get better with vocal rest? No. Polyp will still stay over there ना. आगे पॉलिप नहीं बनेंगे, बट अभी भी पॉलिप रहेगा. So that's the reason best answer has to be option C, microlaryngeal surgery, that is a CO2 laser excision. After surgery, we know always we will recommend a speech therapy also, but it is not the best management overall, because with speech therapy the patient is not going to improve directly. Steroids are given to reduce edema. तुम बोलोगे सर पॉलिप है ना, edema है. For edema, the best drugs are steroids. Steroids are known to reduce edema, beta, but they are known to reduce the edema which is caused due to infection or inflammation. Okay, so यहाँ पे it is not seeming to be an infection or inflammation, and here oral steroids will not be necessary, or they will not be indicated as well. ठीक है? So that's the reason answer has to be option C, that is microlaryngeal surgery. These were the important topics of larynx. Apart from this, there are two more important topics, that is pediatric laryngeal infections. That is, one is acute epiglottitis, and second is definitely acute laryngotracheobronchitis, also known as CROUP. So CROUP and acute epiglottitis are the two important topics as well. They will be discussed in pediatrics, beta. Either I'll take it or other faculties would take it up. So those two are more important topics of larynx. And apart from that, CA larynx, as I told you, that will be discussed with other types of cancers. Okay? So that was all about your larynx, bache. Thank you so much. So those people who are starting again, those who have given exam earlier, I know beta it is difficult for you this time to cope up with the stress. Obviously it happens that itna padha tha to bhi nahi hua hai and all of that. But beta, now it has been a lot of time. I hope that you have started your preparations all over again, and now you're not in that zone still thinking about it ki kyun nahi hua, kya nahi hua. I know it's difficult to digest, but we have to digest failures at times, beta, and we have to move forward in life. Got it? So success is not final, failure is not fatal, as I always say. Okay, it is the courage to continue that matters, right? So please remember कि अभी जो हिम्मत है तुम्हारी, उसके साथ ही please keep on studying, please keep on giving your best. Okay, if you have any kind of doubts, you can reach out to me beta on any of my Instagram handle, Telegram handle, WhatsApp, Facebook, anywhere beta. Okay, so if you have any doubt, definitely you can reach out to me. So with my name complete, you can find me on Insta or with this ID. Okay, on Telegram you can find me on the group beta, that is Phoenix Prep for Next. Okay, so you can reach out to me for any kind of doubts over here at any point of time. Okay, the PDF also you will get in this groups itself, any other PDFs as well. ठीक है? So पढ़ते रहो बच्चे, कोई दिक्कत है reach out. Okay, and all the very best. Thank you so much. Till the next